Now we are ready to proceed with our first speaker. Our speaker for today is a highly esteemed medical specialist from the Epidemiology Bureau of the Department of Health. She is a public health practitioner who began as a rural health physician in Batanes. She eventually led the DOH provincial team for Batanes before leaving to train in the field of epidemiology at the Epidemiology Bureau. Currently, she heads the COVID-19 Surveillance and Quick Action Unit, whose aim is providing quality data to be used to guide our response and long-term strategies to control the COVID-19 pandemic. To enlighten us on the transmissibility of the new COVID-19 variant and other associated risks, let us welcome Dr. Alethea R. de Guzman.
Yes, thank you very much, Leandra, and good morning to all the participants. As an anak of a teacher, it is a pleasure po to share what we know to our DepEd partners po. Would it be okay for me to share my screen po, or are you going to share po the PDF file I sent po? Ah, sorry, is the host going to go on and share the file I sent, Leandra?
Yes po, Doctor.
Ah, sige. So please go ahead to the first slide po. Okay. I've just been given permission to share screen. So this will be a very short lecture, but more of a sharing of what we have when it comes to ano po ba tong surveillance na pinag-uusapan natin, and what are these been hearing a lot of in the recent months po, no? So I'd like to start off by giving some numbers, no? So una po, as of the 7th of February, we have already registered for 537,310 confirmed cases. So when we say confirmed cases po, ito po ay mga individuals who tested positive on PCR test na siya po ang ating lone confirmatory test po sa ngayon. Of these more than 500,000 cases, meron po tayong halos 5% na tinatawag po nating active cases. No? These are the ones who remain isolated or are admitted because they are shown to be still infectious po. No? And of these, 5% has severe or critical disease. Pag sinabi po nating severe or critical ang disease, meron po silang mga warning signs. Usually these are pneumonia na nagpapakita na mababa po yung level ng oxygen sa kanyang katawan, o kung critical po, maaaring kinakailangan na po na naka-intubate, no, at ginagamitan ng mechanical ventilator. What we've seen is that while in previous months, our severe and critical cases comprise around 8 or 9%, nakakita tayo na bumababa na po yung porsyento po, no, na may severe or critical disease, and that is a very good sign. Our recovery rate, meaning ito po yung mga nakatapos na ng isolation nila, sila po ay nag-improve na or wala na hong simptomas sa ngayon, is 93% of these more than 500,000 cases. And we want this to be as high as possible po, no? At sa ngayon, 2% of our cases are fatalities, no? So, and the common causes of death will be respiratory illnesses or mga respiratory conditions po usually. This is a bar graph showing ilan po ba yung kaso na nagkakaroon po ng pagkakasakit, no, sa bawat linggo. At nakikita po natin na nag-peak, no, sabihin pinakamarami yung kaso natin noong mga kalagitnaan po ng Agosto. At ito naman ay tuloy-tuloy, no, dramatically bumaba po talaga siya. Subalit ito pong nakaraang January, nakakita tayo ng unti-unting pagtaas po ng ating mga kaso, no. Ito yung pataas, no, na linya at mga bar graph sa may dulo po nitong image na to. At nakikita natin na itong pong pagtaas ng cases na to, these are correlated to how we celebrated, no, or how mobile we were during the holiday season. So people went home to their provinces, and as Filipinos, no, culture talaga natin to celebrate the holidays with friends and with families. And we're seeing now a rise in our cases after that holiday. So, given these numbers, the National Action Plan po, no, these are being drafted by our national task force, has seen fit to have these goals, no? So, ano po ba at the end of the day, yung gusto nating ma-achieve with all our response activities? Una, we want to prevent having more cases, and we want to contain or mitigate and to slow down the transmission to a point na mababawasan natin, no, yung napakalaking epekto ng maraming kaso sa ating social, sa ating economic and ating security areas po, no. The NEDA has shown that this COVID-19 pandemic has severely impacted sa ating economy, no. In fact, ang term nila nag-contract, no, marami po yung loss in terms of income, in terms of revenue, and we want to lessen that as much as possible and pave the way to recovery, not just of the individual people, but the recovery of our nation as a whole. And so the objectives of the plan is to still continually reduce, no, yung dami ng kaso na nare-report natin at nakikita natin. Ikalawa po is paigtingin, no, palakasin yung tinatawag nating healthcare system capacity, and I'll talk a little bit about that later. And ito po, no, pag-uusapan din natin yung paano ba yung ating immunization or vaccination roadmap, no, as we see this as a measure that will greatly reduce the number of cases that will have ng COVID po. To also enable na magbukas ang ating ekonomiya, magkaroon ng safe at sufficient na transportation para sa ating public, at ma-ensure na yung mga businesses, no, especially essential businesses and services, ay ma-disrupt as little as possible, at kung at tuloy-tuloy na po, no, ang ating mga businesses and services. And last will be to mitigate what they're calling the socio-economic contraction. And in relation to these goals and objectives, ito po yung strategies, no. So the first is we continue to respond because we have cases, no. So the response operations are meant to prevent as well as to lessen the number of cases that we see. But the second is vaccination. So vaccination will be the key to ensure na ang ating population will be protected against this COVID-19 disease. And we want to go onto the path ng recovery po, no? So when we say recovery, again, it's not just about the person recovering from the disease, but our economy is also recovering po, no? So, and I'll just go on to show, no, sa detect, no, which is where our topic now will concentrate. It's actually composing of surveillance through active tracing, no, or active case finding po. At yung mahalaga po yung pag-test, no, sa ating mga nahahanap na kaso at mga nahahanap po na close contacts. However, this response has been recently enhanced dahil nga po dito sa detection at sa report ng mga tinatawag nating variants. So, ano po ba yun? At paano po nagsimula na nakakita at naka-report sa atin itong mga tinatawag nating variants of concern? It was in December of 2020 when the UK reported that they have detected this new variant of SARS-CoV-2. SARS-CoV-2, siya po yung pangalan ng virus na nagkakos ng COVID-19, no? And this variant is of the B.1.1.7 lineage po. And we'll talk about that a little bit later. So, nakita po nila nang nag-sample po sila ng around 5 to 10% of lahat ng mga ng population po nila na meron pong bagong variant, no? At based po doon sa tinatawag nilang models or mga estimates, nakikita nila na it is 70% more transmissible. Sabihin, mas madali po siyang i-transfer from one person to another. No? At ang ibig ding sabihin nun, dahil mas transmissible po siya, mas mabilis po yung pagtaas o pagdami ng ating mga kaso. Subalit, ang nakikita din po nila, wala pa pong ebidensya na nagsasabi na mas marami ang may severe or critical na pagkakasakit because of this variant, o di kaya mas marami ang magiging deaths because of this variant, o di kaya ay may epekto ba siya o wala sa ating gagamiting bakuna. So, currently, the small studies being conducted po show na aside from this increased transmissibility, wala na pong ibang um, harmful characteristics po itong tinatawag na UK variant po. However, of course, these are just smaller studies and we need to really learn, no? And to better get to know this variant para nga po ma-determine natin kung may implikasyon ba siya how we test or implikasyon siya on how we vaccinate po, no? And as of this date, there are already 25 cases positive for this UK variant in the Philippines. So paano po ba na-detect itong mga variants na to? At meron po tayong binabanggit na B.1, .1, .7 na lineage. So we do it through whole genome sequencing. So when we talk about whole genome sequencing, basically you're trying to identify the fingerprint of a virus, no? So parang tayo, each person will have its unique fingerprint. Ganun din po yung other organisms po natin. At nakakatulong po siya so that we can really compare, no? So kung meron po ako nakikita na isang grupo ng mga taong nagkakasakit, no? Tawag namin doon, clusters, at ikukumpira ko sila sa iba pang mga clusters, pareho po ba yung nagkakos, no? Down to the DNA level, pareho po ba yung nagkakos na organism? Yes, there's the same virus, but yun nga po, nakikita natin, may iba't ibang klase, no? Iba't ibang variant ng mga virus na to. And there will be, as we'll know later, there will be variants that will cause, such as the UK variant, that causes more transmissibility, no? So we also want to see how we link, no, one outbreak to another, no, and the cases within that outbreak. So halimbawa, sa ngayon, nakikita namin karamihan na po ng mga kaso natin, hindi na nila alam, no, saan ba nila nakuha, saan ba sila nagpuntang lugar na naging dahilan upang maging isang COVID-19, magkaroon po sila ng COVID-19. So with whole genome sequencing, it's possible for us now to identify kanino sila nakalink or suppose. So last one that I'd like to go on and say about these variances that we see through whole genome sequencing is that pag sinabi nating may variant, hindi naman po siya palaging masama, no? Kinakailangan na i-relate natin doon sa characteristic nung variant na yon, no? Yung tulad ng nabanggit ko, ito ba yung klase na mas marami po ang nagkakasakit o di kaya ito ba yung klase na mas malala ang nagiging pagkakasakit, no? So, very rarely, though they're most often than not, they are not harmful, no? But there will be times po na, yun nga po, meron po silang negative effects. So, I keep on talking about variants, but technically, they're actually mutations. So, sabihin, nagbabago yung characteristic, no, genetic profile ng isang virus. At ito pong mutation na ito ay nangyayari siya naturally because, you know, the genetic variations that happen in an organism is actually a survival mechanism para ang isang organism talaga ay mabuhay, no? So, syempre, ang virus, ang goal niya ay ma-transfer po from one person to another. So, it wants to improve its capacity to transfer or to infect one host and other hosts po, no? Kaya lang, kung makikita nyo, nagsimula nga po itong COVID-19 sa China, pero habang kumakalat, no, at dumadami po yung lugar na nagkakaroon po nitong COVID-19, may mga lugar na nagde-develop, no, nagkakaroon ng sarili niyang mga variants, no. Kaya sa nasabi dito, yung geographic separation may lead to some appearance of unique variants in this areas. Yung namin, no, nagkakaroon ng lineage, no, sariling linya, no, or family tree, kumbaga, doon sa mga areas po na yun, no. And as I've mentioned kanina, most often than not, these variants or mutations do not cause any harm. But much like these variants of concern, it can increase its ability to infect others, more severe disease, or even more deaths. So, I'll go on to the next slide and just show kung ano po yung tatlong variants of concern na nare-report po ngayon aside and that includes this UK variant that we've been hearing a lot of, no? So the first nga po is the UK variant. So technically the lineage is this, no? Yung B.1.1.7 po. Ikalawa ito South Africa, no, with this lineage. And the third is the Brazilian variant po. So, bakit po natin sila tinatawag na mga variants of concern? Una, base nga po sa mga reported data, nakakapagpataas po siya ng kaso, no? Dahil mas mabilis yung transmission niya from one person to another, no? Nakikita din natin na sila po yung tinatawag naming predominant na variant sa kanilang mga lugar. Sabihin, the most commonly occurring variants sa mga nasi-sequence po nilang samples, variants na ito po, no? Kaya lang ang sa ngayon yung ang I guess the positive side on this is while they do increase transmissibility, yun nga hindi pa naman po natin nakikitaan ng ebidensya na sila po ay yung klase na mas makakapagpalala ng sakit po nila, no? However, because we have identified these variants already, we need to monitor within our country kung ano ba yung, kung nandito na ba sila, and we've already identified the presence of the UK variant in the Philippines. But we need to be on the constant lookout kung baka nakapasok na po ba ang South African variant and the Brazilian. One of the things po na ikakavyat ko or siguro I'd like to emphasize is that napakahalaga o napaka strong po ng relationship ng pagtaas ng kaso sa pagkakaroon ng mga variants, no? So again, these are mutations, and as we have more cases, the mutations, the possibility na mag-mutate ang isang virus, tumataas po yung chance ng yun, no? So that is why kung gusto natin, no, na ma-minimize yung appearance ng any variant here or variants of concern here, or magkaroon po tayo ng sariling variant in the Philippines, one of the best strategies is really push our numbers, yung dami ng kaso na meron po tayo, to as minimum, as low a number as possible po. So, that's where biosurveillance comes in, no? So, how do we detect these variants? It's actually the combination of routine, the usual surveillance we do, plus the whole genome sequencing po na sinasabi ko. And that's actually the component, those are the components of biosurveillance. Ang biosurveillance, ito yung paggamit ng ating disease surveillance para yung kanyang mga datos at ang kanyang mga information na nag-generate ay magsilbing early signal, no, mga warning signs po para agad po yung response natin, no? And we mitigate the effects of these health hazards to the public as much as possible, no? Pero hindi po to bago. Sabi ko nga, ito ay nagsisimula doon sa dati pa rin namin ginagawa na naghahanap ka ng kaso o naghahanap ka ng mga health events, no? So balit ito ay nako-complement ngayon nitong mga bagong tools and methodologies. One of which is whole genome sequencing and yung tinatawag din naming big data analysis, no? So sabihin hindi lang siya daan or libo, we're talking about hundreds of thousands to millions of data, no, which requires more parang strong, higher end or better equipment para mas mabilis po nating ma-analyze, no? Pero ang isa rin dapat namin at ini-emphasize namin sa surveillance, sa biosurveillance ay ito ay hindi nagre-replace ng ating mga current systems. In fact, it wants to connect, no, and strengthen these systems. And when we say connect, it's not just at the national level or regional level, pero nagsisimula po siya sa local hanggang dito po sa national level. And the goal is to have quality data. No? When we say quality data, ito ay napapanahon, timely, ito ay tama, at ito ay para siya maging relevant, no? At makahulugan po para sa atin. So, in response to this need to strengthen our biosurveillance, the Department of Health, no, has issued this circular. No? These are interim operational guidelines para kung maimbestigahan nga natin itong nare-report natin na UK variant or nakasulat po dito na 0.1.1.7 na lineage. At ito po ay nagsasabi na napakahalaga, no, ng coordination among our stakeholders. And we talk about stakeholders, it's not just DOH, it's our laboratories, our regional offices, and our local government units, and of course, the UP Philippine Genome Center, where we send our samples for sequencing po, no? Ikalawa, napakahalaga na sharing of ng ating information, no? Kaya kapag ang Department of Health ay may bagong impormasyon tungkol dito sa mga nire-report na variants, ito ay agaran nating nire-report sa public. At ito rin po ay itong mga tulad po ng ating webinar, isang magandang oportunidad po para sa DOH na ipagbigay alam po yung mga ganitong updates, no? And I think as DepEd, one of the things na napakahalaga is yung kung sa ngayon po kasi sarado po ang mga classes, no? Pero sa pagbubukas ng ating mga schools in the future, napakahalaga po ng pagre-report ng DepEd sa atin kung meron siyang nakikita na mga clustering or outbreaks of diseases in their schools or in their offices so that we can immediately respond and contain those clusters or outbreaks po, no? At yung ikatlo is yung, sabi nga natin, no, kailangan consistent yung datos natin, dekalidad yung datos natin. At ito nga po ay nagsisimula sa pagkolekta ng datos, no, from the LGU, from our reporting facilities, from our hospitals po. Para pagkatapos po na makuha namin ng sequencing data, ay makakarakterize po namin itong mga variants po na ito. Okay. So I'd like to end with this emphasis on the need to strengthen the BTITR strategy, no? So madalas na itanong sa amin is, so what happens now kung meron nga ditong UK variant? Anong mga bagong strategiya? Kung tutuusin po, ito pong tinatawag naming PDITR strategy or the prevent, kanina po, detect, isolate, treat, and recovery strategy, they remain as one of our best measures to prevent any increases that these variants may bring about. Especially now na pasimula pa lamang po ang ating vaccination program at it will take time, no, for us to vaccinate a large enough percentage of the population para ho ma-fully bring down natin yung ating mga case numbers po, no? So I listed here 3 major strategies, no, or activities po in relation to this strategy, no. So for us, yung mga susceptible, yung meaning yung mga posible pa pong ma-expose, para hindi na nga po sila ma-expose. It's really the minimum public health standards. We cannot overemphasize the importance of masking, of physical distancing, of avoiding these crowded places, of hand hygiene, of disinfecting your surfaces, no? They are really the best measures for us from being infected, no, or being exposed to possibly infected individuals. And when I talk about these minimum public health standards, hindi lang mamang po siya sa public, no. Napapansin namin dito sa Metro Manila, ang bait nating mag-wear ng mask, no, when we go to malls or when we go to public places. Pero it should be done consistently even when you're in your workplace, no. So hindi kayo kaibigan, magkakilala yung magkakahawaan. O di po kaya sa bahay, no? lalo na kung may mga kasama po kayo na mga matatanda na or may mga comorbidity, napakahalagahang protektahan po natin sila, lalo na kung tayo yung mga lumalabas, no? We don't know what we may be bringing inside to our homes. So we need to also practice this MPHS in our homes. No? Second, if you were exposed and now potentially infected po kayo, how do you prevent yourself from infecting other people? Doon po papasok yung DIT, no? DI natin, yung detection and isolation. So, napakahalaga po ng disease surveillance. Kaya ho, pag may tinatanong po, kayo ay nakaramdam ng mga sintomas, napakahalaga ng pagpapatingin, napakahalaga
Thank you.
kapag kayo po ay nagkonsulta at kayo po ay kinuhanan ng impormasyon, kumpleto po yung impormasyon na binibigay po natin sa mga nag-i-interview. Yung ating CIF na tinatawag o case investigation form, yun po, atos na po namin doon ay napahalaga at yun po ay ina-assure namin that are being kept confidential and private po, no? At yung ating mga kaso at yung mga madedetect po natin sa contact tracing ay mahalaga rin pong matest with PCR. At kung kayo po ay masabihan na isa kang case or isa kang close contact o yung kaya yung mga papasok po natin mga travelers, napakahalaga ng pagtatapos po ng isolation or quarantine. No? Yung absence po of any sign or symptom among cases or among close contacts doesn't mean na ikaw ay okay na at hindi ka na nakakahawa sa iba. Napakahalaga na matapos yung 10 araw na isolation o di kaya 14 na araw na quarantine para po ma-assure tayo na pagkatapos ng period na yun, tayo hindi na po nakakahawa sa ibang tao. And the last is we want to, of course, increase our recovery. No? Sabi nga natin, we want to push them to the spectrum na magre-recover sila at sila ay magiging alive after their illness rather than becoming fatalities po. And that's being done by our departments through our partner agencies by increasing ating healthcare capacity. No? Kaya doon po papasok na ang ating mga hospital, ang ating mga health facilities will have enough dedicated beds and enough people to attend to our cases po. No? So ito po yung ginagamit nating strategiya upang sabi nga natin, no, regardless of the presence of a variant inside the Philippines, these are still the same strategies we employ because we found them to be our best measures, no, regardless of any variant of concern. So my last message po here is, so what is at stake, no, for DepEd, no? How can we contribute to our fight against this COVID, no? Let's be advocates, no? Ako, sabi ko nga po, ako ay anak ng isang teacher. Napakalaki ng respeto po talaga na ibinibigay natin sa ating mga guro, no? Parang ako, ikalawang nanay ko yung mga guro ko sa aking paaralan mula pa nang ako ay nag-elementary. And iba po talaga pag teacher po yung nagsabi, no? So let's be advocates on the practice of these minimum public health standards of infection prevention and control, as we've seen them to be the best ways to prevent us from getting infected, no? And narinig ko nga kanina yung infodemic, no? So in our fight against this COVID-19 pandemic, may kasama pandemic, and minsan it brings more harm, no, than the pandemic itself. We need to correct the information shared. We need to make sure that the information we share is correct, no? It brings, especially when it comes to ano ba talagang COVID, ano ba yung variants na to, safe ba yung mga bakuna natin. So, napakahalaga na kasama, no, partner po namin ng DepEd in ensuring that right information is disseminated to our public. And last ko po is yung mensahe na the health workers are often called the frontliners, no, and the first line of defense. I believe that because we are given the right and we are given the power to ensure that tayo po ay healthy, no? Health is always in the hands of the people, no? Government can always tell us what to do, ano yung tama, ano yung mali, pero at the end of the day, it's an individual decision whether you wear a mask, whether you're not going to go to that social gathering kasi ang daming tao, hindi nag-physical distance. So, it's us, no? In fact, tayo yung unang frontliners po talaga. The individuals here, the residents of our community, each one are the frontliners and each one has a stake in fighting, and I really and I know not just surviving, no, but really successfully combating and ending this pandemic. So with that, again, thank you for the opportunity and a good day to everyone.
Ayan po, marami pong salamat sa ating speaker for today. Mukhang marami po tayong natutunan mula kay Dr. Alithea de Guzman. In the next few minutes, we would like to take this opportunity for Dr. Alithea to clarify some questions that our audience may have. And to facilitate this part of the program, I would like to welcome and Director Ronilda Ho for this portion.
Thank you, Lily. At maraming salamat, Dr. Alithea, no? Informative. At nag-agree po ako sa inyo, medyo malaki ang hinihingi, no? Para sa mga educators, para po makatulong sa pagpapalaganap ng tamang impormasyon. Kaya naman napakahalaga ng science, ano? So magmumula po kami muna sa basic questions ng science kasi ang mga bata na may mga chikiting, paano ba ipaliwanag ng mga magulang, ng mga teachers? Siguro yung mga mas high school, alam na nila yung may mga, or kaya kahit college, mga biology class. So ma'am, as simple as lang, yung tipong balikan natin yung virus muna bago siya nag-mutate, ano? Dok, pag sinasabi yung virus, buhay po ba ito? Ibig sabihin, pag nasa labas ng katawan, nasa loob ng katawan, buhay po ba siya? Gumagapang ba yan? Kasi sabi ng mga bata, yung virus andyan. Baka pag dinapuan ako, nagsalita ako, dumapo sa kamay ko, gumagapang ba yan? Pupunta sa bibig, gano'n. Ano po ba yon? Doon muna ako, Doc Alithea.
Sige. Thank you, ma'am, for that question po. No? So yes, a virus is a living organism po. Buhay po siya, no? Pero ang virus po, para po tuloy-tuloy siyang mabuhay, kailangan po niya yung tinatawag nating host. At kadalasan yung host ay tayo. Tayong mga tao po ang kanyang host, no? So kailangan niyang mag-transfer from one person to another para tuloy-tuloy po siyang mabuhay, no? So ang tanong ni ma'am, paano pag lumabas siya, no? So ang virus po na ito ay nakaka-transfer or siya po ay lumilipat from one person to another by coughing or sneezing, no? Tawag namin sa kanya, it's a droplet infection. So pag ikaw, tayong dalawa, lalo na kung less than 1 meter apart po tayo, habang tayo nagsasalita, o di kaya unfortunately bigla kang naubo or humatching, yung pong mga droplets galing po sa ating laway, sa ating kung meron po tayong from our nose, pag yan po ay na-transfer to another person na langhap niya po, yun po yung tinatawag naming way they are transmitted from one person to another, no? Isa pa po, kung halimbawa ikaw ay humatching, ginamit mo kamay mo lang, no? So yung ating mga kamay at yung mga surfaces kung saan pwede pong na nag-drop, no? Or na napuntay itong mga droplets, posible din pong yun ay mga sources of infection. So yun nga, example po, you sneeze, then you shook the hands of another person without even washing your hands. Tapos yung person na yon, nilagay niya sa mukha niya o sa bibig niya yung pinang handshake niya sa inyo, posible pong matransfer, no, yung virus from one person to another. Kaya ho yung ating MPHS, ang ginagawa niya, sinastop niya yung transmission na yun. So you disinfect more than at least a meter from another person, and then you need to disinfect surfaces, and yung hand hygiene, napakahalaga po ng hand washing po natin.
Sige. Doc Alithea, yung tanong, so sabi mo kasi, di ba, kailangan niya ng host para mabuhay, para tuloy ang buhay. So ibig ba sabihin, pag wala siyang host, nasa labas siya ng katawan, hindi siya buhay. Yung the way we understand buhay, para lang maklaro po natin.
For a while it is. So sabi ko nga, kung halimbawa humatching ka, napunta sa kamay mo o sa ibang surfaces mo, it can live up to several hours po, no? Kaya ho, kapag kaya ho yung ating nire-recommenda is always wipe down surfaces. You don't know, no? Lalo na yung mga doorknobs o yung mga table, hindi mo alam kung sino yung humawak nun, or baka meron pong naiiwang droplets doon na nagko-contain po ng virus. Though it will parang eventually mamamatay din po siya outside, it can stay alive for for several hours pa po kasi outside of your body and while on these surfaces.
Okay. So pero hindi po siya gumagapang, ganon, o nagsisip sa skin.
Hindi po.
Yan. Para klaruhin lang.
Hindi po. Naiwan lang po siya kung So kung andun po yung droplet, andun lang po siya. Hindi po siya yung parang move from one area to another po. Not like that po.
Sip sa skin. Yung
Hindi po siya na-absorb through our skin po.
Yan.
Even if many po mga open na surfaces.
Yes. So para klaro po yung basic science natin dito sa ano. So Ma'am Alithea, so pumasok na siya sa katawan, yung virus na yon, di ba? So, anong ginagawa niya sa katawan at bakit nagkakasakit ang katawan? Bago po ako pumunta sa mutation.
So, yung ating virus po, no, I think baka po masyadong technical kung ano pong ginagawa niya. Basically, it attaches to our cells, no? And sa pag-attach na po sa ating mga cells, nagkakaroon po ng pagbabago sa katawan. At yung mga pagbabagong yun yung dahilan ba't meron po tayong nararamdaman. At mga common na nararamdaman po kasi natin with regards to COVID is yung pagkakaroon ng lagnat at pagkakaroon po ng mga respiratory signs and symptoms. So tulad ng pag-uubo, pagkakaroon ng colds, no? O kaya masakit ang lalamunan. And if sabi ko nga po, kung mas severe or mas malala po yung pagkakasakit, posibleng merong pagkukulang sa paghinga, no? Nahihirapan pong puminga po, no? Yun po yung most common na signs and symptoms. At ang isa pang term namin in medicine, I think, yung pathognomonic or unique na sign and symptom po kay COVID is yung nawawalan ka ng panlasa at pang-amoy po, no? Na hindi mo alam kung ano po yung ibang dahilan talaga, no? So, yun po yung mga kadalasang pagbabago o simptomas na mararamdaman po kung ikaw po ay na-infect po ng COVID. Ngayon, gusto ko lang pong dagdag na kung titingnan nyo, itong mga signs and symptoms na to, common siya para pong nagtrangkaso ka lang, no? Kaya ho napakahalaga yung pagpapatingin para malaman nyo kung ang nararamdaman nyo ba ay baka simpleng trangkaso lamang o baka po ay dahil na po sa COVID-19.
Yan. Sige po. Ngayon, dumako ma'am tayo, Docs, doon sa mutation. Sabi nyo nga, yung virus naman talaga nag-mutate all the time, di ba, sa loob ng katawan natin. So, dahil kailangan niya survival. Pero bakit po na, sa ibang bansa, nangyari na ito? Bakit dito sa ibang bansa, hindi pa? O posible po ba na nangyayari actually siya sa ating bansa or sa ibang bansa na hindi pa nag-report? Parang ganon. Posible po ba yun? Na hindi lang actually siya nangyayari doon sa UK na nag-mutate siya, pero kahit dito sa atin, yung tanong na yon. At ano po ang factors na nagko-contribute sa mutation niya? Yan. Meron po bang factors, Doc?
Yun nga po, natawag lang po siyang UK variant because it was first detected in the UK. No? Hindi ho ibig sabihin na doon po talaga siya nanggaling. No? Yun lamang po sila po yung unang naka-detect po nito. And as mentioned po, ang mga variants po ay nangyayari dahil yung mutation na to at yung nagpo-push kung bakit nag-mutate yung ating mga viruses or other organisms po is habang dumadami po yung kaso, tumataas po kasi yung chance na magkaroon ng mga mutations po, no? So, yun po yung actually single determining factor for the appearances of these mutations or variants, no? Kaya yung isang mensahe po namin is we want to lessen the possibility na magkaroon ng mga ganitong mutations at variants by keeping our numbers as low as possible. So, we need to keep transmission as low as possible po para kumonti ang kaso. At dahil mas konti ang kaso, mas lessen po yung replication, and dahil less ang replication, there's less chances of the virus mutating into a new variant po.
So Doc, sa atin sa pinag-aaralan natin na progress naman nito, wala pa tayong nade-detect naman na sa atin ay bago, parang ganon. Wala naman.
Yun po, base po sa lahat ng na-samples namin, wala naman pong variant na unique or galing po sa Pilipinas, no? And hopefully wala po tayong ma-produce na Philippine variant.
Dok, saan po dinidetect ito? Ibig sabihin sa ang laboratorio ginagawa ang para alam ng ating mamamayan.
Ayun. As mentioned po kanina, no, so the uh, primary, our partner primarily is the UP Philippine Genome Center po, no? Doon po tayo nagpapadala ng mga samples para i-sequence, habang yung iba pong mga laboratorio natin, tulad, I'm sure mas familiar po kayo kay RITM. So balit dinedevelop pa po, no, yung capacity ni RITM para dito sa whole genome sequencing. So sa ngayon po si UPPGC po ang ating partner, as well as aside from RITM, we have the UP National Institutes for Health, no, as partners in this effort. Pero kay PGC po tayo nagpapadala ng lab ng samples for sequencing.
Sige po. May kasama po ako actually na magtatanong sa inyo kasi inaayos namin yung galing sa audience din at yung mga katanungan. Boni, baka meron kang idagdag na tanong related sa tanong ko o para bago ako pumunta sa transmissibility naman. Meron ba?
Yes, sir. Actually, may mga tanong tayo from our participants. By the way, good morning, Doc Thea. Ako po si Bonnie ng DRRMS. Magandang umaga po sa lahat ng ating participants. May mga katanungan po tayo sa ating mga participants, no? Mula sa ating mga participants. In connection nga po dun sa nabanggit nyo kanina na regarding the transmissibility of this virus, na mas mataas nga yung transmissibility nito, resulting na sa mas mataas na pagtsansa ng pagtaas ng cases. So in connection to that, ang tanong po is, in connection to that is yung, so to counter that is yung vaccination nga na ginagawa natin. At ang tanong is, kung nag-vaccine na po ba, hindi na daw po ba madadapuan ng COVID na virus na ito? At garantisadong ligtas daw po ba ang vaccine na ito?
Well, I think Director Bev will be able to better expound later. Siguro po sa bakuna po, ito po yung masasabi ko, no? Wala hong bakuna na 100% effective, no? So, meron lang po siyang certain percentage na effective po siya. And depende po sa dose, no? Kaya dito, kadalasan ng ating mga bakuna, 2 doses. So, isabihin, pag naka-isang dose ka lang, posibleng may certain level of protection ka. Tapos sa second dose, tataas po yun. So, the vaccination is supposed to give you as high a protection as possible from these viruses, no? And sa ngayon, kailangan nating habulin na makapagbakuna tayo as many as possible po ng ating mga priority subgroups, dahil ito nga po yung nakikita nating paraan to really slow down, no? Yung transmission po natin, no? So, kaya po yung advocacy namin na we need to vaccinate, no? And if you're given the opportunity to get vaccinated, whatever that vaccine may be, let's take that opportunity because it's one of the best ways to protect ourselves, our family members, and our community po.
Sige, siguro last questions, Dr. Alithea, no, related din sa transmissibility. Kasi sinabi niyo naman na mas transmissible talaga yung new variant. Anong ibig sabihin ng mas transmissible, ma'am? Kasi di ba ang transmission lang naman, laway na baka pwedeng i-simplify para ma-picture out ng ating mamamayan. Tapos po, yung transmissibility na yon, mas kanino siya transmissible? Sa matatanda, sa bata, may age level po ba? And then the last of that is, meron po bang interaction ang transmissibility sa nutrition? Halimbawa po, doon sa mga mas natin, mga kababayan natin, yung walang mga bata natin, halimbawa, stunted growth, walang makain, walang yun po ba nakaka-apekto po ba yun, yung interactions na yun sa kababaihan, sa pregnant women? So may clusters of questions po. Thank you, Doc.
Sure po. Yung transmissibility po, ang sinasabi lang po niya, mas madali po siyang matransfer from one host to another po, no? At yun ay makapasok sa katawan ng host, no? So it improves their chances of getting into your body, and then ang term namin is nagbabind po siya, no, doon sa cells natin, no? Yun po yung paraan po kasi ng isang virus po para po ma-infect niya yung buong yung katawan, no, ng isang host, no? So pero hindi po ibig sabihin na transfer po from one host to another, at sabi nga natin mas madali po siyang isipin na lang natin, kung tayo pong dalawa, mas madali po kitang mahawaan at matransfer ko sa yung virus compared to the other variants po. Pero yung term na mas ako ba ang magkakasakit kumpara po sa another group, iba po yung, doon po papasok yung pong sinasabi niyong host factors. Posibleng ako na transferent po ako ng isang virus, I may be infected po, pero kung ako ay magkakaroon ng sakit or gaano kalala po yung sakit ko, hindi po siya nakadepende sa virus na to. Nakadepende na po yan sa sarili ko pong pangangatawan. So, nakikita natin ngayon, the risk of more severe disease, kadalasan po makikita natin talaga sa mga mas matatanda, sa mga napakabatang edad, sa may mga comorbidities po, no, tulad ng diabetes o di po kaya mga cardiac illnesses, no. So at yun po yung nakikita natin, no. Kaya yung sinasabi natin, if we want to prevent this transmission, doon po papasok yung masking po talaga, no. So I think as Filipinos, though we're getting into the habit, hindi po natin culture na mag-mask po talaga. Pero I would have to say it's one of the best physical barrier to prevent the transmission of the virus from one host to another po.
Sige. So tama po ba intindi ko, Doc? Ibig sabihin lang noon, yung sabi mo nga transmissibility, mas madali lang siyang makapasok sa katawan. Mas madali lang
Yes
siyang
po.
ma-open yung ating mga cells para mag-interact. Parang ganon.
Yes.
Okay.
Tama po kay Director.
Oo, pero yung epekto niya at lahat, depende pa rin doon sa sinasabi natin, may comorbidity ka ba, ganon, di ba? Poor ba ang nutrition mo at yung sistema mo,
Tama
maayos.
po.
Hindi. Sige.
Tama po.
Salamat, Dr. Alithea, for this basic na sa amin kasi kailangan namin ma-establish po ang basic understanding namin lahat at papunta naman kami doon sa vaccination, kaugnay ng virus mismo at sa vaccination. Thank you, ma'am, at sa uulitin po, ha?
Yes po. Salamat po again for the opportunity and a good day po to everyone.
Ingat po.
Thank you very much, Dr. Alithea. And with that, the Department of Education, Disaster Risk Reduction and Management Service would like to award the Certificate of Recognition to Dr. Alithea R. de Guzman for being the resource speaker in the webinar on the new variants of the COVID-19 and the government's vaccination program. This certificate is signed by Undersecretary Elaine B. Pasqua and Undersecretary Jesus Mateo. Thank you very much. And before we proceed to our program, I would just like to acknowledge all our participants today. Welcome to the Undersecretaries of the Department of Education, Assistant Secretaries, Bureau Service and Office Directors, Minister of Basic, Higher, and Technical Education of BARM, Regional Directors, School Division Superintendents, Regional and Division DRRM Coordinators. Welcome to our webinar. Isang munting paalala lang po, sa ating mga audience viewers sa Facebook Live, maaari po kayong mag-send ng questions through the comment section ng ating Facebook Live. Now, let us proceed to our next speaker. Up next is a medical doctor with a background in public health and postgraduate training in microbial immunology and medical biotechnology. For 10 years, she served as the director of the Institute of Biotechnology and Molecular Biology of the National Institutes of Health, Philippines. Later on, from 2007 to 2013, she served as the Dean of the College of Public Health at the University of Philippines, Manila, while also serving as the director of CIMO TropMed Regional Center for Public Health, Hospital Administration, Environmental, and Public Health. Currently, she serves as the chairperson of the DOST Expert Vaccine Panel on COVID-19 Vaccine Clinical Trials, and is also a member of the World Health Organization Scientific Steering Committee for COVID-19 Solidarity Vaccines Trial. To talk to us about the immunity through vaccination as a response to COVID-19. Let us welcome Dr. Nina G. Gloriani.
Magandang umaga sa aking mga kaguro. You know, I'm also with the academe, and thank you, Leandra, for that introduction. So I think I will just share my screen if it's okay with you. So, ang assignment code for this morning is to give you an overview of the immunity that we achieve through vaccination as a response to COVID-19. Well, of course, vaccination. So for the outline of my presentation, we have to know the disease, and we know that already, but I'll run through it very shortly, in a very short period lang. What is a vaccine, and why do we need a vaccine against COVID-19? I'll run through the steps in vaccine development para lang may idea po tayo gaano kadami ang dapat gawin, i-test, and how long it takes. And then we go into the COVID-19 vaccine platforms, that there's so many types of them. And we have to choose the ideal vaccine type to develop, and then how all of these vaccines work, the immune responses generated following natural infection and following vaccination. So meron po tayong natural immunity versus artificial, which is the vaccine-induced immune responses. And how the immune markers of protection, meron po tayong mga ganong biomarkers sa ating katawan that will correlate with efficacy or protection against the virus. And then I will go through the concept of herd or community immunity and some take-home messages. So I think marami na po kayong narinig, no, about SARS-CoV. It's been a year, more than a year na po, no? But we have to understand the disease first, how it causes disease. At here, I show here, ito, no, nasabi na ni Dr. Thea kanina, how do you get the virus? Ayan, uubos, mag-hatching, droplet also. So, and then we get specimens from people para ma-detect talaga na COVID nga siya. And then later, may iba pa po mga test kasi I'm trying to say all of this kasi they will be relevant to the vaccination, the explanation about the vaccine. So may mild disease. And here, andito yung virus, the patient will recover usually from a mild disease or even a moderate disease. But with severe disease, there's about 4, 5 to 10% chance of dying. So iba-iba po, and you note here na medyo iba yung mga immune markers natin sa mild disease at sa severe disease. And that is how we know what to do. We can give possibly intervention depending nga dun sa mga cytokines that are produced and so on. So we have to know that. But first, before I go into the steps of vaccine development, let me define vaccine. Well, what is a vaccine? It is a biomedical product that stimulates a person's immune system to produce immunity. So very familiar po tayo sa term na immunity to a specific disease. So specific po ang vaccine to any disease. Hindi po na-vaccinate ka ay parang general na protektado ka na sa lahat. Hindi po. Protecting the person from that disease. So it resembles the disease agent. Ito po yung disease agent natin. Kamukha niya yung ating vaccine. Either yung buo or part of it. So it mirrors the virus, kamukha ng virus or parts of the virus, but will not cause disease. So yung vaccine po ay harmless. It stimulates the body's immune system to recognize the agent as foreign. Alam naman po natin pag mayroong mga foreign materials na nalanghap tayo or na-inject sa atin, we generate an immune response. So the immune system will destroy it and remember it. So meron tayo pong tinatawag na mga memory cells that will allow the immune system to more easily recognize and destroy any of these microorganisms that it later encounters. So maybe after 1 month, 6 months, maybe even longer than that, years, meron po mga vaccines na maganda ang na-elicit na immune response, mga memory cells, kaya matagal po ang protection. Naaalala nila na, oy, nakita na kita, lalabanan kita. So, the vaccines make people resistant to infection without having to experience the disease. So, let us now run through the steps in vaccine development. So, first nga, sabi ko, we have to recognize the disease as a distinct entity. Kailangan po nating maintindihan mabuti ano ba ang ginagawa nitong virus na to at paano nagmamanifest as a disease. Kasi susundan po natin lahat yan as we prepare, develop the vaccines. So, ito, ayan yung virus na kinakalat. Pinag-aralan po yan. We have to identify the etiologic agent. Right now, ang dami na po nating alam tungkol sa virus kaysa 1 year ago. No? Medyo hirap tayo at that time, except na sinabi natin coronaviruses, but now we know so much more about the structure, the very specific antigens of the virus. Then the virus has to be grown in the laboratory. And technically, meron pong mga cell lines. Hindi naman virus cell lines lang ang meron. Iba-ibang klase rin po yan. But generally, they use virus cell lines para po patubuin, padamihin ang virus. At yun po magiging pwedeng gamiting bakuna, pwede siyang, pag pinatubo na, pwedeng i-kill, inactivate by physical or chemical means, or there is a process of attenuation na iwi-weaken lang yung virus pero buhay pa. Dito sa una, patay na, no? Masisira yung DNA niya, kaya hindi na siya makakapag-replicate. Pero meron din po mga bakuna na weakened lang. For COVID, meron pong mga ganong bakuna pero hindi pa sila advanced stage of development. So after growing, you can choose to make the whole virus as your vaccine. Or you can choose specific parts or antigens of the virus. So nung pong January 10, 2020, yung genetic code of the Wuhan strain was first published. And eto po na, yan. No? So makikita nyo dito, syempre may mga iba-ibang parts ng genome and specific to the genetic sequence for the spike, and dito po ito. So it took Moderna 2 months to develop their vaccine, the messenger RNA vaccine. Of course, mas marami pa po ang ginawa bago syempre pwede na siyang i-test. But it took them 2 months to prepare or develop this sequence para maging vaccine. Okay. So just to refresh you on the sa dogma, no? Everything starts from the DNA. Lahat po yung sabi nga ni Dr. Thea kanina, yung fingerprint natin, blueprint minsan na sinasabi natin. So yung DNA codes for, let us say, the spike protein, and then natatranscribe siya into messenger RNA, and then the messenger RNA is translated into protein. So para lang po maintindihan natin, may mga bakuna na ito ang ginagamit, yung DNA sequence ng spike. Meron po mga bakuna, yung nga po Pfizer and Moderna, diretso sila sa messenger RNA. So nawala yung isang step na yon, no? So the messenger RNA will be translated into the spike protein. So kaya may iba-iba po tayong mga klase ng bakuna based on yung dinevelop na technology ng ating mga vaccine developers or companies. So I'll run through this again in a while. So napaka-importante po na kuha natin agad yung genetic sequence or genetic code ng at least yung Wuhan strain. Of course, na iba na naman po yung mga strains, no? Sabi nga ni Dr. Thea, yung mga variants. We'll explain that also later. Okay. So after that, na-choose na natin yung mga type ng bakuna na gusto nung developer na gawin, kailangan po mag-establish sila sa animal model for the disease. Kasi titignan po doon kung yung bakuna ay magiging epektibo sa mga animals at kung makakaprotekta, especially dito sa mga tinatawag natin animal models. Ito ay marmoset, wala naman tayo niyan dito, pero sa ibang countries po, siya yung ginagamit, pati yung mga ferrets para animal model for COVID. And then, for many vaccines, ginagamit po natin yung non-human primates, especially yung rhesus macaque. Then, aralin po yan, no, in an animal model for disease, and then we identify an immunologic correlate or immunologic correlates for immunity to the disease. So usually, ito po ay serum antibodies. So blood ang ating kukunin. So kunin niyo yung plasma, yan po, andyan po yung mga antibodies, or meron tayong white blood cells dito, dyan po natin makukuha yung mga T cells na pag-aaralan natin kung sila ay na-activate at kung anong mga cytokines na napoproduce nila na makikita nyo later, mabuti siya, protective ba yung mga cytokines na yon or hindi. Okay. So after nandun na po yun, no, na decision na anong klase, they have to be evaluated for safety, immunogenicity, and efficacy. So madali na madali naman po lahat po ng mga products ay tinitignan for safety from the preclinical pa lang po, sa animals pa lang. Titignan na muna yan kung safe sa animals. Kung makaka-produce po ba ng immune response at kung makaka-protect. Efficacy is really protection. So from preclinical development, which is basically the laboratory and animal studies, and to the clinical trials in humans. So meron po sa human trials, may phase 1, phase 2, phase 3, and then magkakaroon ng regulatory approval, but after regulatory approval, meron pa tayo pong phase 4, ito po yung post-marketing surveillance na sinasabi. I can explain that later kung gusto po ninyo. But, so makikita nyo yung proseso, medyo mahaba, no? Then along all of this, throughout all of these stages, they need to prepare the candidate vaccine for quality vaccines following good manufacturing procedures. Kahit nandito pa lang yan. And then, of course, mas lalo pag nasa humans na po. So, let me now present to you the different types of vaccines or what we call now vaccine platforms. So for yung mga vaccines natin before, yung mga EPI vaccines, polio, measles, konti lang pong platforms ang ginamit nila. Pero for COVID, grabe po, ang dami nating types ng vaccines kasi mas advanced na po tayo ngayon. Ang ating mga technologies allow us to go into all of these, try all of these platforms. So ito nga po, no, you have your whole virus here. The spike protein, ito yung crown niya, yung corona, is the one that binds to the receptor ACE2, yung receptor sa katawan ng tao. So doon siya magbabind at doon mag-initiate ng infection. So because that is the one that binds the host cell receptor, the spike is looked at as a very important molecule to neutralize. So yung pong spike ay kung meron kang antibodies against the spike, manuneutralize yung virus at hindi na siya makakapasok sa ating katawan. So please take note that there are many vaccine types that are based on the spike. Actually, mas marami po siya kaysa doon sa vaccines na buo. So, sa buo, dalawang klase lang po, inactivated na na-mention ko na kanina, weakened, killed virus, or attenuated virus. But for the spike, meron to yung RNA vaccine, may DNA vaccine, may recombinant protein vaccines, at may vectored vaccines. So, explain ko din po ulit mamaya yan, pero lahat po sila ay dadaan sa mahabang proseso para maging ma-approve ng ating regulatory agencies. So, ito po, well, a little more detail here. I-isolate yung gene which describes the SARS-CoV-2 spike protein. So, pwede pong ang tagadala, may tagadala siya. Itong spike ay dadalhin ng isang vector or carrier virus. So, marami pong klaseng viruses ang pwedeng gamitin na tagapagdala ng code ng spike, pero ang meron po tayo ngayon available ay binamitan ng adenoviruses. So yung adenovirus ay non-replicating, but it is good at eliciting immune responses. So dala-dala nung adenovirus yung gene coding for the spike. Pagpasok sa katawan, Of course, you generate antibodies against the adenovirus, but more importantly, you want the body to recognize na meron siyang daladalang spike, and the immune response will also be generated against the spike. So yung subunit naman po ay yun na lang, kukunin nila, either ipupurify nila, there are methods, ways to purify the spike protein from the whole virus, or it could be a product of recombinant DNA technology. So pwede pong may ibang system like yung baculoviruses na magpo-produce ng marami nito. Actually, may dala-dala din siyang gene code for the spike. Tapos, yung mapoproduce niyang spike ay ipopurify, yun lang po ang laman ng bakuna, but usually with an adjuvant. So, ito po, no? So, makita nyo dito sa vector, meron pang kasamang ibang virus. Dito sa subunit, mag-isa na lang siya. Doon sa nucleic acid, wala pa po yung protein, yung spike, pero meron siya nung sequence that will code for the spike para makaproduce ng spike yung nabakunahan. So, na-explain ko din po kanina, pwedeng DNA na nucleic acid or RNA. So, cells which have taken up the gene-producing spike protein ay will produce yung spike, and then yung host, yung taong nabakunahan, ay magpo-produce ng immune response against that spike. So that summarizes what I have just said, is summarized in this just one slide. So ito po yung buong virus. You can inactivate it, usually UV, physical inactivation, or chemical means, or attenuation. Medyo mahaba rin po ang process sa attenuation, and of course dahil buhay pa, pwede pong makabalik yan sa wild type. But of course, titignan din po nila yung level of attenuation, dapat sufficiently weakened so that it will not cause disease but will still generate an immune response. So ito ulit yung mga spikes, o pwedeng may tagapagdala ng code for the spike protein, or you use the DNA, or you use the RNA, or just get the subunit itself. And then, meron din po tayo ng, of course, with the nucleic acid sequence, alam na natin yung magiging amino acid sequence nito. So based on the amino acid sequence of the spike, it is possible to produce synthetic peptides that could also be used as vaccines. So meron din pong ganitong mga developments, pero nasa early stages lang po sila. Ang mas mature ay itong mga pakikita ko later. So now, we can put names to these vaccines. Ito naman po ay marami pa pong ibang names, pero ito po yung medyo advanced, and the vaccine companies, yung vaccines nila, that the vaccine expert panel and the FDA have actually evaluated or currently also evaluating. So for inactivated, ito yung buong virus, Sinovac, Sinopharma, and Bharat Biotech. So yung dalawa ay China from China, Bharat Biotech is from India. Those are viral vector-based vaccines. We have AstraZeneca. This uses chimpanzee adenovirus. Yung Janssen po, or J&J, Johnson & Johnson, uses adenovirus 26. And Gamaleya, or what you probably know better as Sputnik V, uses adenovirus 26 and adenovirus 5. So, ito pong sa protein subunit, Novavax dapat po ito. Meron po tayong yung Novavax, which should come in also maybe this middle of the year, 2021. Meron din po manggagaling sa Clover and Anhui Zhifei from China, and I think may collaboration din sila sa US. And then, ang mas kilala nyo siguro ay yung messenger RNA vaccines, kasi dahil mabilis silang na-produce dahil nga galing lang sa genetic sequence, so madali din silang na-aprobahan, nagawa yung clinical trials and then the approval. So Pfizer and Moderna, pero baka may dadating din po, nakita rin namin ang technical dossier, well actually some of the technical data of these two vaccines from Inovio. This is a US-based company, and Andes Osaka in Japan. Pero hindi sila kasing advanced nitong iba dito. And meron nga rin pong live attenuated vaccines, pero very early pa po ang kanilang development. So if we look at all of this, ideal po ba sila? Because what is an ideal vaccine? Andito po ba yung mga characteristics na gusto natin? Well, of course, usually ang number one parati natin sasabihin ay the vaccine has to be safe. First and foremost po parati yan, safety. And then they have to be immunogenic, meaning they can elicit immune responses, the appropriate immune responses. And the immune responses or the immunity has to last long. Kaya nga sinabi ko kanina, yung memory cells ay important. Kasi hindi pwedeng bakuna ng bakuna mayat maya, no? Sana maganda ang bakuna na kung kailangan man ng booster, it will take some time, siguro years. And protect against disease, ito po yung efficacy. They have to be stable in field conditions. Pag in-store nyo yung vaccine, kasi yung deployment is also important, no? Paano kung sa mga bulubundukin kailangan din natin immunize, ano, or so mga yung talagang islands medyo mahirap po kung masyadong mataas ang requirements for cold chain kasi like the Pfizer would require minus 70 to minus 80 degrees or freezing conditions to be stable kasi otherwise madali po siyang ma-denature. Then we would prefer a single dose. Why? Sa isang pandemya, kailangan po mas maraming tao sana mabigyan ng isang bakuna lang at maganda na ang kanyang epekto, no? Pero sa ngayon, ang magiging available po ay will require 2 doses. And I will explain also why, no? And then lastly, the vaccine has to be affordable and accessible to all who need them. Parati po nandyan sa equation ang equity. So, hindi po pang mayaman lang ang bakuna. So, then, sabi natin, we look at the safety, immunogenicity, and efficacy. So, we first look at the safety. Just one slide on safety. I'm sure you're very familiar with them. We sometimes use the term side effects or adverse events or reactogenicity. Ibig sabihin, pag nabakunahan tayo, meron po tayong reaction. Ang una ay local side effects. So, ito po ay injectable. Kasi meron din pong binibigay orally, di ba? Yung oral polio vaccine. At meron din pong intranasal. I think yung flu meron ganon. Although baka sa Philippines, wala tayo na. So, local side effects. Pain at injection site, you expect that. Siyempre, masakit. Pwedeng mamula or inflamed at the injection site. Or pwedeng magkaroon ng rashes and itchiness. So, these are relatively common side effects. But there may be local side effects, but there may be systemic side effects. So, pwede siyang makakos ng fever, headache, fatigue. So, marami po sa mga COVID vaccines ay yun ang nire-report. Fatigue. Parang yung feeling na pagod.
Anong sa among subject wala siya nag-comply? So, ask yourself, anong wala man nag-comply sa imtang sa ubang subject? Comply.
Meron pong dizziness and muscle aches and other side effects. Okay, so tinitingnan po namin during the evaluation kung ito po ba after yung clinical trial results nila, no? Mild ba, moderate, or severe? Most of these vaccines would elicit mild to moderate side effects. So, ang mas marami po talaga ay mild. Then, merong konting severe and maybe we can also put in here na yung severe ay serious adverse events ang tawag natin and they are not really that common. But we have to also know, expected ba itong mga side effects na to? Sometimes we get unexpected side effects kasi any biological agent given to, of course, a biological person, mga tao, iba-iba po ang ating biological responses. So medyo pwedeng magkaroon po ng unexpected side effects. Then common ba itong mga side effects na to or rare? Ang allergy po ay rare. It can happen. So meron din po tayong tinatawag na adverse events of special interest. Ito po yung hindi nga talaga nakikita normally sa marami nating mga bakuna, pero pwedeng mangyari sa isang tao. So, pero iimbestigahan po kung ito po ay may causation doon sa vaccine. So that is very important to determine causality. Are the side effects due to the vaccine or caused by other conditions not related to the vaccine? And that is very important po. Kaya nga po tayo sa ating clinical trial, mayroong vacuna at saka yung placebo. pwedeng yung placebo, may nabigyan ng placebo ay meron din ganung side effects. So titignan po mabuti yung causality. Dahil ba sa bakuna or something else? So, given all that, the benefits of the vaccine must outweigh the risks or side effects. So now I will go to pag na-establish na po ang safety, actually lahat po ng yung nabigyan ng EUA at yung mga iba pong tinitignan namin ngayon, maganda naman po ang kanilang mga safety profiles. So now, punta po tayo on how the vaccines work. So this is actually from UNICEF ba to? No, British Society for Immunology. So the vaccines actually, where we want long-term immunity, no? But we do not know that yet for COVID-19. The vaccines should train your immune system using, as I said, the harmless form of the virus. It should activate your what we call adaptive or specific immune response. And that involves B cells, T cells. So B cells ang gumagawa po ng ating mga antibodies. So may na rin po tayo ditong review of immunology, and then T cells that can help stimulate the B cells and kill any infected cells. So meron po tayong memory that will allow us to have long-term immunity. So, siguro ito hindi ko na lang po masyadong i-explain, pero maganda kung may time po kayo later, you can look at this. So, ito yung ano nangyayari. Iba-iba po kasing klaseng mga cells ang pwedeng ma-activate, and we look at some of them in H1 cells. Anong mga cytokines, mga molecules ang kanilang pinoproduce that will allow us to evaluate, is this the profile of cytokines that we want in a vaccine or not? So meron po tayong mga ganong measures. Ito po yung mga biomarkers that we try to evaluate. So marami po pong iba, no? So, ito po naman ay yung sa natural infection, ito po yung mangyayari, itong nasa left na panel. So, anybody who gets the infection, this is general po, no? Pwedeng ang virus ay makikita natin within the first 5 to 7 days, at least within the first week. Madidetect natin yung virus sa katawan ng tao. Either, well, pwedeng nasa blood, or in the case of, pag very early, nandun pa lang muna sa nasopharynx or kung saan siya pumasok, no? So we either detect viral genetic material or the antigens, the antigen test or the RT-PCR na test. Then, if the patient will recover, and most will recover, actually mga 90% po ang mag-recover, we can detect antibodies against these viral antigens. So, marami din pong klase yung mga antibodies. May IgM, IgG, IgA, yung IgG, 4 na klase pa po yan. So, we want to see that, no, sa isang pasyente. Pero kung hindi yung iba, so after mag-produce sila ng enough or mataas na level ng neutralizing antibodies, they will of course recover. But some do not recover. Yun po yung kanina in-explain ko, but I will not go through that anymore. Yung nagkakaroon ng mga inflammatory, very severe inflammatory responses and may end terminally, no, sa death. And then, after vaccination, wala na po dapat itong viremia. Ang meron na lang tayo, hindi kayo magkakaroon ng sakit kasi nga harmless yung bakuna na binigay sa inyo. Ang dapat magkaroon na lang kayo ay yung mga antibodies or yung mga T-cells. Hindi po nakalagay dito yung T-cells, pero these are what we want to also see. So, basically, we expect the same level or even higher level of immune responses against the vaccine. So, ilagay ko lang po lahat in context itong mga bakuna na tinitignan natin. Sinabi ko na po kanina, yung mga buo na virus ang ginamit, and we have inactivated vaccines, Sinovac, Sinopharma, and Bharat Biotech. So, dahil buo po siya, andun lahat ng kanyang mga antigens. So maraming, ang antibody responses natin will be against the spike, against that crown. Meron din po siyang matrix protein, envelope proteins, and nucleocapsid proteins. So mas marami po. But generally, when we're talking about protection, we look at the immune response against the spike. Kasi ito po yung una nga na mamimit yung host cell, no? And then for the other vaccines, ito nga, kung DNA, messenger RNA, or yung subunit ang ginamit, antibody responses will only be against the spike proteins. Kasi spike lang po ang ginamit natin na bakuna. So that is true for Pfizer and Moderna, for Novavax, for AstraZeneca, for yun ba to, si Janssen at si Sputnik V. And then, ganun din po doon sa Inovio, no? Immune responses against spike proteins. So, I'll go back to that, to the process of yung vaccination. So, pipili tayo. It could be the whole virus or part of the virus. Ituturok natin. For now, injectable po lahat ng COVID-19 vaccines, pero meron po mga universities or research institutes na nagtatry gumawa ng intranasal. Kasi yun, doon naman po, di ba, na pumapasok yung virus. So, ang body natin, immune system, ay magpo-produce ng antibodies na panlaban sa virus at gusto natin, yung antibodies na yan, ang siyang magbabind, mag-neutralize doon sa ating virus. Then these are these biomarkers or immune molecules that we detect at titignan natin, ini-evaluate natin sa mga nabakunahan. So we call them immune markers of protection. And just to probably say, kasi marami pong mga klase ng test para ma-detect sila. Kaya yun din po ang ina-explain ko na sa bawat isang bakuna, iba-iba pong klase ng bakuna, no? Iba-ibang klase or types, iba-iba rin po ang ginagamit nilang mga tests to detect antibodies or to detect cell-mediated immune responses. So, galing sa blood, yung plasma, antibodies, or pwedeng serum, or do sa white blood cells for the T-cell response. So, ito pong mga antibody tests ay tinitignan din po namin yung ginamit nila sa pagdedetermine ng immune markers kung validated po itong mga laboratory tests na to. So, we look at the class of antibodies. Ang importante po ay neutralizing antibodies. Ino-neutralize niya yung virus. And then, yung dami ng antibodies is also very important. Mas marami, mas mabuti. So, the higher titer of antibodies, higher magnitude of yung na-develop na antibodies, the better. And then, how long the antibodies will stay. For pandemic vaccine, sabi po ng WHO, 6 months ay pwede na. Pero we want, of course, vaccines that will last for many years. The response to the vaccines to last for many years. So makita nyo dito, meron akong sinulat na we prefer a Th1 biased response rather than a Th2. So tinitignan po namin din yan sa aming evaluation kasi importante po yan dahil doon sa mga vaccine-enhanced disease, vaccine-induced enhanced disease. And so far for COVID, wala pa po kaming nakikita ng enhanced disease. So maganda po ang kanilang profile, may Th1 ang profile nila. So after we know the immune markers na makita na natin, ma-detect na natin, ma-determine ang kanilang type, yung kanilang magnitude of the response, then these are correlates of protection. So ang basehan po natin na napoprotect ay ililink natin doon sa kanilang immunity na na-generate. Okay, so efficacy is really protection against COVID-19 disease. So, yung pong COVID ay may mild, may moderate, at may severe. I think we all know that now. So, gusto din natin makita na yung pwedeng may mga pasyente na merong daladalang virus sa kanilang katawan pero wala silang simptoma. So wala ni even mild disease, no? So we will look at that again when I show you yung efficacy profiles nito mga vaccines. So when we look at efficacy, is this vaccine, ang question ay, will this vaccine protect against mild COVID, against moderate COVID, or against severe COVID and maybe death. But through these clinical endpoints, meron din po tayong laboratory endpoints. We have to make sure that yung nagka-COVID, bakunahan o nabigyan ng placebo, we have to check for virological confirmation by RT-PCR. So dapat nandun yung virus for this or wala. And then, medyo I'll explain this siguro mas mamaya later, no? Yung, kasi mas madaling makita yung mild, moderate, severe kesa maaral yung ang bakuna ba ay makapagre-reduce ng virus shedding, meaning pag nabakunahan ka at hindi ka naman fully na protect pero pwede ka pa ring transmit pero low levels ng virus ka na lang meron, lower viral load, and this will reduce transmission. So meron pong konting study doon pero hindi pa po malawak ang resulta. So ganito po. Ito yung mild, lagnat-lagnat lang, ang moderate may pulmonya, pwedeng nasa ospital na pero hindi naman masyadong grabe. Pag severe ay nasa ICU na. Pero ito nga yung sinasabi ko na pwede kayong walang symptoms pero maaari pa rin mag-transmit ng virus or nakakahawa. So now you see all these numbers, yung vaccine efficacy. Sabi sa press release, 50%, 70%, 80%, 92, 95, lahat po ng numbers meron na. So, ano ba ibig sabihin po nun? Then, pag sinabing efficacy, protect niya, it reduces yung makatransmit ng infection, ng severe form of the disease by 50%, by 70%, and so on. So, pwedeng against mild, against moderate, against severe, or ito nga yung gusto natin for all sana, protection against infection to reduce transmission. Ang problema po, hindi naman talagang problema. Iba't ibang vaccines po, iba't ibang datos ang meron sila. So, meron po mga bakuna na test sa general population, meaning 18 to 59 years old without comorbidities. Ito po yung healthy. Meron po mga bakuna may data on the elderly, meaning 60 years and older. Meron mga iba pang bakuna na may silang data sa people with comorbidities against people without comorbidities. And for at least Pfizer, yung sa children, ang kanilang tines kasi 16 years and older. Siya pa lang yung merong ganon. Kasi 18 po yung ating sanang cut-off, no? Pero all other vaccines, except nga for Pfizer, 18 years and above sila. So Pfizer lang ang medyo may younger population na data. And then there are some vaccines that have been tested in the immunocompromised, yung mga HIV positive patients po, especially sa Africa. And then meron pa rin pong special groups. So importante po ang context ng vaccine efficacy when we look at these different groups that where the clinical trial was tested. So, andito na po tayo sa vaccine efficacies across these different vaccines. This changes a lot. Actually, dapat chinesh ko na noong February 3 na yata to or 4, no? Halos every day po we see new data. But remember, what we see on press releases may not be entirely correct. Kasi po, kailangan namin makita yung technical data bago po namin masasabi na oo nga, totoo nga pala na ito ang kanilang vaccine efficacy. Kasi meron po mga tinitignan na statistical analysis, subgroup, subset analysis na sinusundan po ng ating siyensya. So let me look. So we have here listed the vaccine brands that we are more familiar with. Ito po yung papasok sa ating country. So andyan po ang Pfizer at Moderna, which are both messenger RNA vaccines. Then we have AstraZeneca, Janssen, and Gamaleya. Ito po yung adenoviruses, pero may difference nga. Chimpanzee itong AstraZeneca. Ang Janssen is adeno 26 and Gamaleya or Sputnik V is adeno 26 and 5. And then yung Sinovac ay siya yung whole virus, siya pa lang yung na-evaluate namin. And then na whole virus, and then yung Novavax ay may konting datos na po kami dyan, and most are coming from yung international publications. So Pfizer, vaccine efficacy after one or first dose, ang isa dito po ang Janssen ay siya pa lang yung nagsasabi na gusto niya magbigay ng isang dose lang, but all others 2 doses. So doon po sa Pfizer,
kabalo ka ning nag-mute naman sad ko oy.
Vaccine After the first dose, 52.4% po ang vaccine efficacy niya. Pag nabigay na po yung 2 doses, which is 3 weeks apart, 95% na po ang kanyang efficacy. But against severe disease, ito po yung kanyang nabigay na datos, 66.4%. Then, pwede ko naman po i-explain na lang later itong efficacy niya against variant strains kasi medyo iba po the way they measured yung binding ng antibodies against their vaccines doon sa mga variants together with Moderna, no? So anyway, ang Moderna, makita nyo, after one dose, 69.5% ang vaccine efficacy. After 2 doses, almost 95% or 94.4%. And it has shown 100% vaccine efficacy against severe disease. So what does that mean? Wala, yung naprotektahan na magkaroon ng severe ay mas marami ng konti kaysa sa Pfizer. But of course, pag sinabing against severe, pwedeng yung mga iba po ay hindi nila protektahan doon sa mild and moderate. Then for AstraZeneca, the overall, the one after one dose, vaccine efficacy is 64. Okay naman po itong mga values na to kasi the WHO only requires 50%, at least 50% vaccine efficacy. So even after the first dose, pasado naman po sila, no? After the second dose, yung AstraZeneca tumaas ng 70.4%, pero mataas din po ang kanilang efficacy against severe disease. For the variant, they're still collecting data, but recent data shows 67% vaccine efficacy in reducing transmission. And not so much with the variant. Ito naman po ay may early data sila on yung sa, di ba, apat po yung sinabi ko, mild, moderate, severe, and then yung last is to reduce transmission. Sila lang po so far ang may kine-claim na data that they can actually reduce transmission in 67%. Then do sa Janssen, ang kanilang sinasabi naman ay pwede lang ang isang dose, 66% overall. Actually, halos pareho do sa iba. Then when they check this in Latin America, 66%, in the US, 72%. I think at that time, meron na din po mga variants na umiikot, and 57% in South Africa where you have the yung B135 na variant. Okay. Then sa Sinovac, I could not get the vaccine efficacy after one dose, but after 2 doses, it varied from 50.38 in the Brazil trial and 91.25% in the Turkey trial. But they are saying that the vaccine is efficacious against severe also in 100% of the time, the new cases. And for Novavax, after 2 doses, ito po yung subunit vaccine, mataas din po yung kanyang efficacy at 89.3%. And ito pong 60% niya in South Africa ay nung ginawa yung kanilang trial sa South Africa ay meron na pong umiikot na variant ng South Africa. Kaya what that means is, kunwari sa UK, maganda yung efficacy pero pag ginamit sa South Africa, mababa na po. So yung implikasyon ng variants efficacy will change depending on the mutations in the virus. So nyari ito, when tested yung kanilang original vaccine, yung antibodies generated against the original vaccine was tested, 95.6% was still good against the original virus. Doon sa variant ng UK na tinawag kanina, B1.1.7, 85%. So that's still good, no? Medyo nabawasan, pero that's still good. But this is worrying. It is 49.4% against the South African variant, na mas actually marami pong mutations doon sa variant na yon. So ang ibig sabihin lang po, this is under real world conditions versus ito pong ina-explain ko, trinay ko kanina sa Pfizer and Moderna kasi ang data po nila ay sa laboratory lang nila tinest. Tinest nila yung antibodies ng mga taong nabakunahan ng kanilang mga vaccine against the pseudoviruses na prepare nila sa kanilang laboratory. So hindi in the real world situation. Ito po ay real world. Anyway, so we are still awaiting naman the results of other data from Pfizer and Moderna in a real world situation. Sana ganun din po lahat ng iba. So for Gamaleya, after one dose, it's 70%, and after two doses, it's 91.4%, with a vaccine efficacy of 100%. So these were based on interim data from publications and press releases as of January 29. I think may inad ako kayo naging February 3 na po. So nag-change po ito, no? Halos every week. Hindi naman siguro every day. So I highlighted here the point about implications of the variance in vaccine efficacy. So we are probably looking at booster doses later that will be where the vaccines na ang laman po ay yung variant strains will be used. So meron po nang ginagawa ang lahat ng ito ng second generation vaccines for COVID. So, just a few more slides just to explain the concept of herd immunity. So we looked at the safety, the immunogenicity, and efficacy profiles. Now, why do we want many people to get vaccinated? At importante po ito na maintindihan natin, no? Meron tayong tinatawag na herd immunity, yung mga flock po ng flocks, ng mga, di ba, yung herd ng sheep, lamb, ganon. So that only means, pag meron kayong herd, lahat ng herd na yon dapat mabakunahan o maging protektado. Community, no? Community immunity. So bakit kailangan magpabakuna ang marami? Para po magkaroon ng tinatawag na herd immunity. So ito po sa picture na ito po yung isang taong hindi nabakunahan pero otherwise healthy. Merong itong gold ay nabakunahan, malusog. Meron dito na hindi nabakunahan, may sakit at nakakahawa. If we start here in the left side of the panel, dalawa sa 26 na naka-drawing po dito ay may COVID at nakakahawa. Kapag walang nabakunahan sa isang komunidad, kakalat po ang COVID. I think alam na natin po yan, no? So, hindi naman din lahat, pero mas marami, no? 21 na nadagdag sa COVID cases in this case. Na walang nabakunahan at merong dalawang may COVID. Dumami na, naging 23 na. Ngayon, kung sum lang ng populasyon ang mabakunahan po. So, dito, no, kanina walang bakuna. Dito meron tayong 5 na nabakunahan amidst 2 na may COVID. Konti lang sila, no? 1, 2, 3, 4, 5. So when some of the population is immunized, the disease spreads through the population. So here, 5 lang nabakunahan, 16 ang nadagdag na COVID cases. Pero when most of the population is immunized, the spread of the disease is constrained. Mapipigilan po ang paglaganap. So mayroon po tayong tinatawag na indirect immunity. So dito, mas marami na po yung dilaw, yung gold. 20 ang nabakunahan. Amidst them, may 2 may COVID. Dahil marami silang nabakunahan, naprotektahan nila yung iba na hindi nabakunahan at isa lang ang nagka-COVID. So, we are talking here about herd or community immunity. And that value, that is required for any disease agent varies, depending po doon sa kanyang transmissibility. For measles, which is very highly infectious, we need at least 95% herd immunity para po hindi kumalat ang measles. Now, for COVID-19, ang na-calculate po na compute na required for herd immunity is 70 to 80%. So if we achieve that level of vaccination, immunization in the community, we should have sufficient immunity against the virus. And it will indirectly protect others in the community kahit hindi po sila mabakunahan. Ang ina-expect ko po siguro, baka hindi po mabakunahan ng isang may sakit, isang very elderly na frail, Pero if we have sufficient immunization within the community, pati po sila ay mapoprotektahan. So, yun po yung ano ko. So, with that, I have my last slide here, take-home messages. We are now in an era where a new field of microbiology and immunology called vaccinology gives us hope to develop better, safer, more effective vaccines to save lives against the most difficult pathogens such as the SARS-CoV-2. We hope this is the last na, but we do not know. Nagmo-mutate po nga yung mga virus, di ba after SARS-1, nagkaroon naman ng MERS. So we have to be ready and we have to be open to these advances, helping us intervene against these difficult pathogens. For COVID-19, there are so many vaccine types to choose from. Vaccines developed using older, tried and tested technologies, as well as new generation platforms like the messenger RNA and the adenovirus vector vaccines. All these multiple approaches work towards the same goal, producing a safe, effective vaccine against COVID-19. We know that different vaccines, not just one type, will be needed for the pandemic response. And while fast-tracking vaccine development efforts, the need for scientific rigor and integrity in approving vaccines for emergency use authorization and later on, full licensing and commercialization needs to be emphasized. Now, my last bullet here, nakita nyo naman na bumaba yung effectiveness, vaccine efficacy against the variants. So the lower vaccine's effectiveness against variants is a compelling reason why we should be vaccinating as many people as we possibly can in a short period of time. The virus variants can be controlled if enough people are immune to the virus so that it cannot spread and mutate anymore. Kasi di ba, sabi po ni Dr. Thea, mas maraming tao ang may COVID, mas maraming virus na nagsisirculate, mas mataas po ang mutation. So, go back to that na dapat wala na tayong COVID cases. So, marami pong salamat and let's answer your questions.
Ayan, marami pong salamat, Dr. Nina, for that enlightening talk on vaccination. So through Dr. Nina, we learned that the vaccine allows our bodies to develop an immune response against the virus. Although there are side effects to the vaccine, what is important to note is that the benefits of the vaccine must outweigh the risks. Maraming salamat din sa ating speaker for clarifying the meaning of efficacy, the implications of the variants on the vaccine efficacy, and the meaning of herd immunity. So we have the next few minutes for the public's clarification for our resource person. Once again, I would like to welcome Dr. Ronil Daco and Sir Bonimar Lumabaw.
Good morning, Dr. Nina. Maraming salamat po. Very,
Good morning po, Director ko.
Oo, thank you, ma'am. Siguro mag-umpisa ako, balikan ko kasi tinanong ko si Ma'am Althea kanina nung basic ng virus para lang po kasi ang tanong ko kanina may buhay ba, medyo categorical. Pero iba kasi ang ginagamit yung term na capture ko. Gumagamit kayo kasi ng activated, inactivated. So mas appropriate po pa na sabihin na outside the body, the virus is inactivated. Wala siyang capacity na tulad ng buhay na mag-reproduce, mag-metabolize, mag-grow. Tama po ba yun?
Sa labas po ng katawan, pwede siyang mabuhay ng a few hours. Depende po sa klase ng virus. Pero hindi po siya pwedeng dumami. Kasi nagre-replicate lang siya sa loob ng cells.
Yes, so parang mas appropriate po na sabihin na inactivated rather may buhay o walang buhay. Parang ganon. Tama po ba? Inactivated.
Walang capacity to replicate.
Okay.
Kasi yung inactivation po is a laboratory procedure. Pero pwede din pag nag-disinfect tayo, may inactivate din natin sila. So it's a general
Opo, kasi ninunuance ko ma'am para pag iba-ibang levels ng students or
yes, ma'am.
Oo, para lang po mas maipaliwanag yung mga terminolohiya. So, salamat po doon. So, yung capacity na sabi mo mag-replicate, wala siya sa labas ng katawan. Okay. So ma'am, ito naman po, pupunta na po kami dahil na-underscore nyo yung importance po ng vaccination. Na mas liliit nga po ang transmission natin, mahahawaan pag may vaccination. Pero ibig pang sabihin nito, ma'am, pag halimbawa, ang isang tao, o ako halimbawa, na-vaccinate ako. So, pwede pa rin po akong mahawa, di ba? Ganon. Or, so isang tanong po yan, nahawaan pa po ba ako kahit na-vaccinate na ako? Ang ikalawang tanong na kaakibat nun ay, makakahawa pa po ba ako pag nakuha ko siya kahit na-vaccinate ako, in case makukuha ko pa rin siya kahit vaccinated ako, makakahawa pa po ba ako? So yung magkadugtong na tanong na yun.
Magkadugtong nga po yun. Hindi po lahat wala pong 100% protection ang mga vaccines. Nako, siguro po, miracle yon pag may bakuna tayo na ganon. So meron pong tinatawag na vaccine failure. Ibig sabihin, may kaunti, well hopefully kaunti, no? Pwedeng marami. Kasi nga kaya tayo may vaccine efficacy na hindi gagana, hindi tatalab yung vaccine sa inyo. Ibig sabihin, hindi kayo magmamount ng good enough immune responses para malabanan ang virus. So somebody na nabakunahan ay pwedeng hindi nga mag-take yung vaccine sa kanya. Kaya nga, pwede pa siyang magkaroon ng ano ulit. Kaya po natetest natin yan sa clinical trial na bakunahan at hindi placebo. Yung mga nabakunahan ay pwede pa rin magkaroon ng COVID. Actually, nakita natin sa clinical trials. So in that sense, yung pong mga nagkaroon ng COVID following vaccination, na nag-fail yung vaccination sa kanila, ay pwede pong makahawa. Okay? Pero we are looking at very low numbers na ganon. Ang posible rin po ay kung nabakunahan man kayo at hindi naging 100%, bumaba naman yung level ng virus na dala-dala ninyo. So meron namang parang advantage din in a sense. So pero for the most part, dapat hindi na po. Pero may pangyayari na gano'n. Kasi nga may vaccine failure. That's true with all vaccines. Mga 5% at least.
Okay. Sige, thank you, Doc. So, kasi yun yung isa sa mga pangamba ng mga tao, di ba? Na pag ako ba nabakunahan, hindi na ako, sa sinasabi nyo, dahil may efficacy naman, pwede ka pa rin. Pero tama po ba na mas maliit lang ang tsansa ng severe? Parang ganun yung pinakita nyo, di ba?
So kaya kailangan po, pag nabakunahan ng mga tao, tuloy pa rin po yung minimum public health standards natin. Kasi hanggang hindi natin, lalo na kung bago lang kayong bakuna, hindi naman pwede kayo lalabas na agad, Kasi how long does it take for the immune response to be generated? At least 2 weeks po. Kung mas mahaba, better. Mas tataas po yung antibody responses natin. And neutralizing antibodies should be able to protect you. Pero still, huwag niyo kakalimutan yung minimum public health standards. Wala pa po tayo, hindi pa po tayo off the hook, ika nga. We're waiting for about a few years pa. Hanggang ma-sufficiently po ma-immunize ang community. Kaya po nag-advocate kami na sana pag naging available ang vaccines, magpabakuna yung kwalipikadong magpabakuna para ma-achieve po natin yung level ng herd immunity that we need for COVID. Kung magtatagal pa po tayo, sabihin nyo, next year na lang po ako magbabakuna, hintayin ko pa yung iba, baka may dumating na iba. Matatagal lang po natin makukuha yung ating herd immunity pag tayo ay nagtagal, nag-wait, nag-delay.
Okay. Sige. Dok, doon naman po sa mga nagka-COVID na, kailangan pa ba silang magpa-vaccine? Kasi kumbaga, hindi ba na-develop na dapat yung immunity? Tama po ba yon o hindi?
Okay. Hindi po lahat ng nagka-COVID na nag-recover ay mataas ang level ng kanilang mga antibodies. Actually, marami pong mga datos na nagsasabi na parang mga 2-4 months lang, bumababa po yung level ng antibody nung nag-recover. So, yung iba siguro mas medyo matagal. So, dahil po bababa yan, pwede po sila ulit ma-infect kasi hindi na protective. May level, may threshold po tayo na sinasabi, protective level. Kung mas mababa doon, hindi po tayo mapoprotektahan against disease. It could be reinfection to the same variant or pwedeng another variant. So, importante po. So now, for vaccines, pwede pong bakunahan ang mga nagka-COVID na, pero sabi po ng WHO, you have to wait until wala kang symptoms, and usually that will be yung talagang na-clear yan, no? Mga at least 90 days from the time you had COVID. So, and then para masabi ko din lang po, yung mga datos na nakita namin, yung mga nag-zero positive from natural infection na binigyan ng bakuna ay maganda po ang resulta. Tumaas ang antibody level sila. Ibig sabihin na boost. Yung bumaba na ng level from natural infection, nung binigyan ng bakuna, tumaas po yung antibodies. So, okay din po yon. Kaya lang, nandun po sila sa huling prioritization, ha? Kasi baka sabihin nila, gusto ko rin. Nandun po sila sa huli medyo. Kasi nagkaroon na silang COVID. Pero pwede po.
Okay. So ang sinasabi niyo, ma'am, needed pa rin talaga siya kahit nag-COVID ka na. Okay. Boni, may ano ka kay ma'am or tuloy ko lang? Anong ano natin? Kasi doon naman po sa ano, sige, tignan mo kung meron ha. Doon naman po sa efficacy, kasi meron tanong dito sa audience actually ma'am. Nakalagay kasi doon yung ano, yung sa Sinovac ba yun? May term na inactivated. Ano daw po ang ibig sabihin noon?
Yung buong virus po yun, inactivated or killed. Pinatay yung virus para hindi na siya makakos ng harm pag in-inject. Kasi ganun po yung bakuna. No? Pinatay siya using a chemical agent. Ito po yung beta-propiolactone. So, yun po yung usually ginagamit sa mga bakuna. So, it's the entire virus. Grino muna nila sa laboratory, tapos pinatay. Tapos, syempre, titignan nila yung mga characteristics nito. Pure ba to? Yung basta maganda dapat ang quality. Tapos, ginagawang vaccine. So, buong virus versus the others na part lang ng virus.
Okay. Sige po. Ma'am, yung pong ano, kasi pinakita nyo, kahit dun sa Sinovac, meron iba't ibang range ng efficacy, ng 51 to something, ano. Bakit po siya ganon? Kasi kung ibig sabihin, kasi tinest siya sa iba't ibang, ano ba, iba't ibang lahi, ganon po yun, no? So ano pong implication nun? Kasi halimbawa sa bansa natin, magte-test pa po ba ibig sabihin ito trial ba natin bago natin siya i-roll out, ganon ba, para makita natin din ang efficacy noon sa atin? Kasi yun po, medyo kailangan lang pong linaw.
Well, from a scientific medical point of view, ma'am, I would prefer sana na lahat ng papasok na bakuna sa atin ay matest sa ating populasyon. But we are in a pandemic, so hindi po posible na lahat ay matest dahil unang-una, tests are going on around the world na, and pwede naman po mag-generalize in some sense, no? Meron din po mga vaccine trials na mataas din ang mga Asian population na tinignan. So pwede na rin po tayong para mag-extrapolate doon. And meron po kasing expectations nga rin sa mga safety. Halos lahat naman po kahit anong klaseng ethnicity, meron pong ganyang expected. Pero siguro yung efficacy po, maganda sana na meron. Pero okay din lang po kasi yung mga EUA sa ibang countries, ibig sabihin na suri na rin din pong mabuti. So basta at least 50% ay katanggap-tanggap na according to WHO. Ayos na po yun. Saka may konteksto po yung 50 Meron lang isang grupo yun, mga general population. Nga tinest nila sa ibang population. Maaring tumaas pa po yun. Actually, tumaas sa iba po, no? Yung tapos, sa atin, magkakaroon po ng trial ng Sinovac, pero sa elderly po gagawin. Hindi na sa general population. Kita natin na maganda sana po.
Okay. Sige po, ma'am. Kasi sa yun sa mga tanong ng mga tao na hindi po ba, kasi may side effects po nga, diba? So, ang sinasabi, tinatanong, sa may interplay po ba yung vaccine sa iba't ibang klase nga ng tao? Sasabi niyo yung Sinovac, siya sa elderly. Pero paano po yung halimbawa, kasi parang doon sa pagtetest nga, medyo sabi niyo nga may iba-ibang effects, Ma'am, paano sa mga may sakit na, sa may comorbidities na, yung ganon, doon sa pregnant women, doon po sa mga, ang nutrition ay poor nutrition, yung ganon. So, paano po yun? Ano ang interplay na nakita na at ano ang ina-extrapolate natin? Or dito ba sa atin, paano po natin siya i-deal? Or what do you think as a doctor po doon?
Yes, ma'am. Ma'am, una po, ang mga bakuna ay unang tinatry sa general healthy population. Dapat po yon, requirement yon, kasi hindi ka basta pupunta sa isang special group. Okay. Now, through that, kunwari, more than 18 and above, pwede dahil sa dami ng sumali sa clinical trial, there may be enough number of participants na pwede pong mag-subset analysis. So kaya pwede pong yung age groups ay i-define. Ito 18 to 30, 31 to 40, yung mga ganon, and the elderly. So doon po nagkakaroon set analysis. So anong epekto nito sa more than 60? So meron po mga ganong datos ang ating mga bakuna. No? So, kasi ilan ang tines nila? Nasa 20,000. Pinakamababa na 10,000, 15,000. No? So, may enough number to work on. So, pero yung po mga special groups, lalo ang children, ang immunocompromised, yung actually yung sa may comorbidities, marami na rin po silang datos doon kasi mahirap din pong kumuha ng mga participants sa walang comorbidity. So napasama na rin sila. And so far, yung pong mga datos ng mga ibang vaccines na na-evaluate namin ay pareho lang ang response ng may comorbidities at yung wala. Pero yung talaga pong very special populations na immunocompromised o severely immunocompromised, wala pong datos doon. Sa pregnant, nag-uumpisa lang po sila kasi vulnerable population din po yung pregnant women, no? So, pero meron na po silang ginagawa kasi yung mga pregnant women na high risk, mga healthcare workers, so you have to weigh the risk for COVID infection, no? Nabigyan din po sila ng bakuna. Pero hindi yung live attenuated. Wala naman po, yun ang pinakabawal sa mga immunocompromised or sa pregnant. Kasi yung mga iba, messenger RNA, subunit lang naman po yan and should be safe for pregnant women. So meron silang datos na hopefully will be available in the next few months.
So Doc, doon sa sagot nyo, tama po bang sabihin na doon sa mga walang datos pa, no, doon sa na-test na ng mga population groups, ganyan, ay mas maganda na huwag muna silang i-vaccinate, ganun po ba yon?
Doon sa very severely ill, severely immunocompromised, baka titignan po mabuti yan, no? Actually, even doon sa may comorbidities, may mga iniinom na gamot, ang magdidetermine po niyan ay yung doktor na titingin. So, iba-ibang levels po kasi. Nyari ako, marami din akong maintenance, pero I'm relatively healthy. So hindi siya masyadong titignan. Pero somebody nga rin na naka-steroid or madalas may mga acute symptoms nga rin ng asthma o kailangan pong tignan na stable ang condition ng pasyente or yung BP nga rin. No? Meron po na ang blood pressure ay very unstable. Pero kung stabilize ang blood pressure nyo for a few weeks, okay na po. Kaya siguro ang dapat sabihin sa mga may comorbidities ay i-level up nyo po ang inyong health status bago kayo magpabakuna. Kasi minsan yung iba po hindi sumusunod sa mga gamot o di syempre maglulukuhan na yung ating mga blood pressure, mga sugar natin dyan. So let us try to be healthy before and after the vaccination. Okay lang, basta stable po ang medical condition.
Okay. Sige, thank you, Doc. Doon Doc sa sa usapin ng kanina, yung pagkatapos mabakunahan, sabi mo nga dapat nakastay ka pa ng mga 2 weeks or more, the better sa bahay, ano? And then after that po, yung buong epekto, yung effectivity ng bakuna ay hanggang ilang buwan nga po yun or ilang...
Hindi pa natin masabi sa ngayon kasi yung unang nabakunahan na marami, siguro mga 7 to 8 months ago pa lang yon. And so far, meron pa silang antibodies na level that we want. So we'll wait for another few months and maybe even years para makita. Yung SARS-CoV-1 po, yung unang-una, na may bakuna na test pero hindi na nagamit dahil nawala naman ng SARS-CoV-1, no? Yung kanilang bakuna ay tumagal ng more than 1 year, parang 1.5 years, yung antibodies doon. So if we were to parang tignan na lang yung ganong history, we hope na ganon din sana ang itong bakuna sa SARS-CoV-2 na sana tatagal. So we have to wait pa. Yung data wala pa po. Mag-intay tayo this year siguro.
Okay. Sige po. No, Doc, sabi niyo kanina kung mas maigi na sana mas marami tayong antibodies na naproproduce pag tayo ay nabakuna. So ibig po ba sabihin nun, iba-iba din ang reaction. So may mga iba na mas konti, may mas saan dependent po ang production ngayon ng antibodies kung iba-iba ang maproproduce ng bawat katawan?
Sa immunology, dito sa the way I usually explain it, meron po kasi mga tao, may genetic, paano ba yan? Hindi naman vulnerability. Yung genes nila for making immune responses. I normally would say may poor responders to vaccines, may moderate responders at may high responders. Ako, fortunately po ako ay high responders. Naka-isang bakuna, isang dose pa lang, ay ang taas na ng aking level. Pero meron akong isang kasama, nakalima na siya, meron siyang antibodies, pero kokonti pa rin. Dahil po sa kanyang, yung genetic makeup yung iba. So meron po kasing genetics din ng immune response. So meron pong ganon. At kung siguro medyo hindi healthy, medyo malnourished, meron din po konting effect yon. Pero a large of it more is the genetics of the immune response. So kung poor, moderate, or high, let us all pray tayo ay at least moderate to high.
So meron pala ma'am genetic din talaga. Pero kaya po ba na yun, sabi nyo kanina, magpalakas kayo at lahat yung immune system nyo, anuhan din yun. So
makakatulong kahit pa paano yun, yes.
Okay. Sige, Doc. Doc, doon naman po sa Bonnie, meron ka bang galing pa sa audience na questions? May nagsinabi po kayo kasi kanina na yung mga side effects nga iba-iba, di po ba? Meron din yung doon sa severe na. Ma'am, ilang araw bago mo makita, lalo na yung mga severe, na kasi sinasabi nila, may mga sinasabi, di ba, na ang vaccines actually may long-term effects, dahil sa dahil hindi naman siya tama po ba na sabihin na hindi pa natin nakita dahil hindi naman, yun nga, yung buong trial nito ay yung haba nang nakita ang long-term effects. Ano po ang doon?
Basehan doon sa mga datos na meron na tayo, yung general na mga markers na tinitignan natin, maganda naman po ang kanilang profile, no? But of course, we cannot discount the possibility of long-term effects. Pero for this, I don't think that will really be, Kaya, meron pa po tayong post-marketing surveillance. Meron pong possible na long-term effects on a few people na rare that we can only see kapag mas marami na po na bakunahan. Kaya po meron nung tinatawag na phase 4 or post-marketing surveillance. Kasi pag nag-roll out na sa marami, yung isa sa, let us say, 5 million, baka doon makita. Pero kung nabakunahan mo ay 1 million lang, hindi mo siya makikita. So, but that again goes back to our, na the benefits would outweigh the risk. Kung isa doon sa 5 million o 10 million lang ang nagkaroon, mas marami pa rin po ang nakakuha ng benepisyo. But we have to watch out for those. Nakalista naman po yung may tinatawag na pharmacovigilance na plan ang mga vaccine companies. Nakasubmit po yan sa FDA.
And Doc, siguro to end it, so parang ang sinasabi niyo naman po na given what we know, yung alam na natin sa kasalukuyan, ay talagang mas makakabuti na magpa-vaccinate na even then na hindi pa natin alam ang long-term effects nito. Ganon po ba? Kasi yung pag-uwi po ito ng mamamayan yung, di ba, marami tayo hesitant at lahat yung ganon. So, paano ba natin talaga
Yung long-term effects, I think, ay mababa na yung possibility na yon. Ang importante po natin talagang gawin ngayon is to vaccinate, get ourselves vaccinated. Kung qualified tayo, titignan po mabuti yan, yung eligibility and qualification, na baka sasabihin ni Dr. Bemco later. And then para ma-achieve po natin herd immunity. Kasi ganito po, no, kapag nga yung sabi ko, ulitin ko na lang po ulit yun, pag tayo nag-delay pa, eto pa, pumapasok na po ang variants. Nakita natin na nalelesen ang effectivity ng vaccine na unang generation na vaccine dun sa variants. Pag dumami po yung variants, mas lalong bababa po yung efficacy nitong first generation. But of course, ayan, second generation vaccines na ginagawa na nila. But that will be even more expensive and bago po ma-roll out ulit yun. So mas mabuti po na maka-achieve na tayo ng certain level of protection that will afford community immunity. Yun po yung aking last doon. In a mas mabilis, mas mabuti po sana. But of course, depende sa kung kailan dadating ang vaccine. Sana po dumating agad ang bakuna. At gamitin natin. Yun po.
Sige, Doc. Maraming salamat po sa enlightenment, Doc Gloriani. And we hope to have you next time again, ma'am.
Yes, ma'am. Thank you rin po.
And there, thank you very much, Dr. Nina and Director Ronnie, for that. To Dr. Nina, the Department of Education, Disaster Risk Reduction, and Management Service would like to award the Certificate of Recognition to you, Dr. Nina G. Gloriani, for being a resource person for our webinar today. This certificate is signed by Undersecretary Elaine Pascua and Undersecretary Jesus Mateo. Marami pong salamat, Dr. Nina. And to our audience, we will be taking a 5-minute intermission before we proceed to our third and final resource speaker. Thank you.
The COVID-19 pandemic has brought unprecedented changes to our usual ways of living. But the Department of Education remains unfazed by these challenges to fulfill the mission of Sulong Edukalidad, the rallying call for national effort to deliver quality basic education to all Filipinos, which involve aggressive reforms in the 4 key areas: the K-12 curriculum review and update, improving the learning environment, teachers upskilling and reskilling, and engagement of stakeholders for support and collaboration to move forward together as we prepare the education system for the future. The call for Sulong Edukalidad will continue, and we have built the framework of the Basic Education Learning Continuity Plan, or the BELCP, to put the needs of the learners at top priority. DepEd's BELCP is the major response and commitment to protect the health, safety, and well-being of learners, teachers, and personnel. The plan aims to provide opportunities to continue education even in these trying times with a BELCP in place, supported by an unprecedented number of diverse stakeholders from the academe, media, industry groups, NGOs, business and private individuals. Sulong Edukalidad will be able to sustain the aims in its reform for quality basic education. In our journey towards quality education, we have established the 4 pillars of aggressive reforms from the start, and we have been continuing to progress in these pillars. In improving the learning environment, we took action in the construction and rehabilitation of school buildings, ensured the availability of learning materials and equipment, and prioritized our last mile schools. The challenges of the pandemic also brought to light the urgent need to upgrade our ICT infrastructure to service the needs of education. In terms of the teachers upskilling and reskilling, we were able to establish more innovative professional standards for teachers and school heads. We have aligned the professional development of teachers with their career progression to track their development as part of the National Educators Academy of the Philippines transformation. With the launch of the Education Futures program, where we will be focusing on innovative actions and solutions to improve the state of our education, we are now more than ready to start a new journey and continue our fight for quality education for all Filipino learners. Finally, we've given high importance to the engagement of stakeholders for support and collaboration. In support of this, we have convened the Philippine Forum for Accessible Quality Basic Education, or the Education Forum, which will leverage other partnerships for education quality and strengthen partnership with the Philippine Normal University as the country's National Center for Teacher Education. The department has also been developing a professional development program for teachers and school leaders in order to equip them with the skills, materials, and data that will allow them to help their students prepare for PISA 2022. This intervention consists of the following components: online training for teachers and school leaders, development of learning materials and practice tests for students, deepening the analysis of the PISA 2018 results, and supporting school-level action research. Now that the year is about to end, our commitment to Sulong Edukalidad will continue and will be far from being gone. With a lot at stake, considering our new knowledge and experience from this year's challenges, we are equipped to face a new future. As we head on to the future where we will face many challenges and uncertainties, the department will always be the guardian of every Filipino learner's right to education.
child embodies our ultimate vision, that every Filipino learner will realize their full potential and ultimately reach their biggest dreams, no matter how high, no matter how hard, through quality education. And as our learners aim to soar, we must continue to elevate our goals. Rising, the kite is our emblem of aspiration to deliver the brand of quality in Philippine basic education. The quadrants of the soaring kite symbolize the key reform areas in forwarding this cause, as we embark on this aggressive reform to yield upskilled teachers, well-developed curriculum, improved learning environment, and responsive multi-stakeholder cooperation. Using the colors of our flag, the logo symbolizes our unity and serves as a reminder that it takes a nation to educate a child. Together, we as a nation will have to move forward and gain more momentum so that our vision of quality basic education for all shall take flight. Sama-sama sa pagsulong ng edukalidad.
Sa mga panahong ito, ayun, malapit ng July, dapat ang mga bata nasa classroom na nag-aaral, masaya, inihahatid ng mga magulang, but all these things at this point in time, wala.
Na kung saan sumalakay sa atin ang COVID-19 disease.
Paano enrollment? Paano pag-aaral? Sinong tutulong sa amin? These are worries very normal to parents like us. Paano ng mga batang to?
Gusto po namin i-remind ang mga ating mahal na magulang na sila po ay magtiwala sa Department of Education.
At wag po tayong magpatalo na because of this pandemic, ihinto po ang pag-aaral ng ating mga anak.
Ginagawa po namin yung lahat ng aming makakaya para na sa ganon ay tuloy-tuloy po ang enrollment po ng mga estudyante po. Gumagamit po kami ng mga Learner Enrollment and Survey Form o yung tinatawag natin LESF para na sa ganon makapag-fill up na po yung mga magulang na wala pong access pagdating po sa internet.
Para doon sa coordination namin sa mga stakeholders, particularly doon po sa pagbibigay ng mga learners enrollment and survey form, pumupunta po kami by barangay.
Yung boxes na dinala sa mga barangay hall, na yung mga hindi nakapag-enroll ngayon ng online, doon ngayon i-drop yung mga enrollment form ng mga bata. At ang gagawin ng barangay, dadalhin ngayon sa school. At yung mga schools ang magko-collect.
Masasabi namin na kami ay may kahandaan sa mga iba-ibang modality na gagamitin natin dahil hindi nga pwede ang face-to-face instruction.
Doon sa online ay nahihirapan po.
Welcome back sa ating webinar for today. Ayan. So, our final speaker is the Director for Health Promotion Bureau and Special Assistant to the Secretary of Health, and Secretary of Health for Universal Health Coverage at the Department of Health, Philippines. Immediately prior, she was the Chief of Research Division of the Health Policy Development and Planning Bureau, where she worked to provide the evidence needed to support health system reform. She has also worked in the Philippine Health Insurance Corporation and has provided technical assistance to the government of the Philippines and the Southeast Asia on health financing, maternal and child health, and health impact assessment. She co-founded Alliance for Improving Health Outcomes, a nonprofit working to raise the profile of public health and develop a critical mass of public health professionals. She is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative and the Atlantic Institute, and holds an MD from the University of the Philippines and an MPH in Health Policy and Management from Harvard T.H. Chan School of Public Health. To talk to us about the government's COVID-19 vaccination program, let us welcome Director Beverly Lorraine C. Ho.
Hello, good morning. Maraming salamat po for having us here. I'll just share my screen lang po. Alright, maraming salamat ulit sa pag-imbita po sa amin dito sa session na to. We're happy to meet with our colleagues from DepEd again. But more importantly, we'd also like to take this opportunity to drum up interest and commitment to the COVID-19 vaccine rollout in the next few weeks and months. So magkakasama po tayo lahat dito. So, bago ko po mag-start, gusto ko lang po pasalamatan yung few people who actually contributed to this presentation. And I would also like to declare that I have no conflict of interest as it relates to any of the brands that we are going to be discussing today. No? So, mag-umpisa lang po tayo. No? Ano na ba yung COVID cases dito sa Pilipinas, di ba? So maybe nakita niyo na to in previous presentation. Gusto lang po natin ulit i-highlight the age and sex distribution of cases and deaths. Makikita po natin yung mga pink are women, yung blue ay men, no? Tapos makikita natin na sa cases, mas marami po na nandun sa taas, no? And kapag nasa taas, it means the younger population. Here you see that yung pinakamahaba pong bar ay 25 to 29 years old. So, ibig sabihin, most of the cases natin ay between 20 to around 34 to 39 years old. Diba? Pero,
ano po nakalagay kay Ma'am Myra sa number 38?
Pero kapag tumingin po kayo sa right-hand side, dun sa mga namatay po, nasaan po siya? Nasa mas mababa, di ba? Kita nyo po, ang haba po nung bar, no? Pagdating po sa 60 to around 74, tapos humaba pa dun sa above 80, di ba? So all this is saying, at lagi natin ito sinasabi last year sa mga COVID-19 webinars natin, mas disproportionately affected po yung nakakatanda, no? Older men, no? You will see, mas mahaba yung mga bars ng color blue, di ba? So dahil alam natin to, ito yung magbibigay sa atin ng konteksto, no? In the next few slides. Next po, nagkaroon po tayo ng sectoral survey for teachers and non-teaching personnel. And we rolled this out online last year, mga December 29, no? So bakasyon, walang pasok. Pero tinulungan tayo ng ating DepEd to send this out to most of our teachers. 15,000 po yung sumagot, no? Pero gusto ko pong ipakita sa inyo yung resulta. na ang oo o magpapabakuna lamang ay 26%. No? At hindi sigurado ay halos kalahati, 52%, at may 20% na hindi. So, sa mga panahon pong ito, ang goal po natin ay sana magkaroon tayo ng oportunidad para makapag-clarify at yung mga yes ay maging mas malakas na champions, yung mga no ay at least mapaisip, no, na o nga siguro I should reconsider, at dun sa mga not sure ay matulungan natin maging yes or sigurado, no? So, tulong-tulong tayo dito. Gusto ko rin pong ipaalam sa inyo na kapag sinabi natin, ay, na-COVID ka, no? Hindi ibig sabihin isang klase lang yon. We have 3 different types of COVID infection based on severity. So if you have mild, yun yung sinasabing, oh, medyo hindi nararamdaman, parang asymptomatic, pero because it's very, very mild, no? Cough, cold, at usually yung chance of death napakababa. Moderate, may pneumonia, kailangan mo na nang nakakabit yung oxygen dito, at may mga 1% pwedeng mamatay. Yung severe, yun yung talagang na-ICU, no? Yung mga naririnig natin, ako, 3 linggo na nasa ospital, ganyan. So 5 to 10% can die. So in view of this, how I will go on with the presentation will be to answer 10 questions. Etong 10 questions na to ay parang sinasabi natin, must know, no? Mga dapat yung malaman tungkol sa vaccine program. Hindi ko na po kayo totoxikin dun sa mga ibang parts na kami naman po yung dapat may alam, no? Or yung implementer. Kayo po, we're looking at you as champions and as also recipients, no? Ito yung mga dapat malaman ng bawat sa inyo. So first, why do we need to get vaccinated? 2 concepts lang yung kailangan natin maalala dito. May mga benepisyo yung bakuna, tsaka yung benepisyo ng bakuna ay maximum kung at least 70% of the population or ng community ay nabakunahan. No? So una, dun sa vaccine benefits. Dati po, kapag pinag-uusapan natin yung vaccines, naisip lang natin agad. Pwede po ba ako mag-request, no, yung ano natin, i-silent po natin or i-mute natin? Thank you po. Okay. So, dun sa vaccine benefits po, tatlo po yung posible, no, na benepisyo ng bakuna. So, dito tayo. So,
strategy.
Okay. So, kung napanood nyo po, ito po ay yung pagsasalarawan, no, na ginawa po ni Dr. Edsel. Isipin nyo po na yung COVID ay kasing bangis, no, ng isang layon, di ba? At yung epekto po ng bakuna ay pwede pong tatlo, no? So first is to prevent symptomatic infection. So hindi ka na magkakaroon ng mga sintomas, di ba? Nandyan pa rin yung layon, pero hindi mo na makuha yung or ma-experience yung bangis niya, di ba? Second is to prevent severe infection. Nagkaroon ka pa rin ng sintomas, pero hindi ka lang na ICU. So parang yung layon naging puting, no? Yung last is to possibly prevent transmission. Ibig sabihin, hindi mo na maipasa. Bakit, no? Kasi yung layon, na-neutralize na siya, di ba? So ito, bungo na lang siya, no? So ito po yung kapag pinapanood natin sa mga balita, nire-report na, oh, yung efficacy ng isang brand, no? So sinasabi doon na mostly yung nakikita natin is to prevent symptomatic infection. Pero recently, yung mga lumalabas na trial results, pinapublish na rin nila pati itong ability to prevent severe infection at to prevent transmission. No? So, kailangan natin ito lahat tingnan. So, at sinasabi din nga ng mga eksperto natin, itong mga efficacy rates na to, be it 60, 70, 80, 90%, kailangan natin isipin na yung baseline natin ngayon ay 0. No? So, if you're at additional 50% protection, that's good enough. If you're 70% additional protection, that's even better. 90% is even better. But, ang kalaban natin ay oras. No? The earlier we get vaccinated, the better because we don't know when COVID will strike. So the concept naman of herd immunity is basically this, no? Sinasabi niya na yung pula is yung nanghahawa. Kung tayo ngayon, walang bakuna, lahat tayo ay blue, no? Tayo nandito sa taas. Kapag tayo lahat ay kulay blue, si pula, umiikot siya, kaya niya tayong hawaan. At nakikita niyo dito, si red, yung infectious, every time na nakaka-infect siya, makaka-infect siya ng 2 or 3. No? So that's the R0, di ba? And then, makikita nyo na maraming maapektuhan na magiging pula. Ibig sabihin, marami din yung chances na magka-severe infection. Diba? Kasi the more na may naapektuhan, it's a percentage, diba, of the number of people affected. Pero kapag dito sa baba, ina-assume natin na kapag nabakunahan ka, nagiging yellow na tayo. No? Para tayong naka-recover na. No? Para tayong considered recovered patient or may antibody na or immunity. So kapag nag-iikot si taong kulay pula, hindi kanya actually nahahawa. Diba? At ito yung gusto nating mangyari. Ano pa yung importante dito? Merong mga tao, hindi talaga sila pwedeng mabakunahan. So sila yung continuously blue, no? Blue yung color nila. Sino to, no? Meron iba, kunwari habang, no? In the middle of chemotherapy, sila yon. Merong mga special groups of population na hindi talaga pwedeng mabakunahan. So we are helping, all of them na nakabakuna, we're helping them kasi hindi na tayo nagiging pula. At kapag nagkipag-interact ng mga blue sa atin, hindi natin sila nakahawaan. No? So talagang ito ay community helping each other out. So to summarize what I just told you, yung pagkakaroon natin ng immunity could be given to us by natural infection, but it could also be given to us by immunization. No? So yung antigen ay yung COVID, no? Yung masamang parte ng COVID. Yung immunogen, yun yung nasa loob ng bakuna, no? So parang ginaya niya yung antigen, pero hindi siya yung totoong COVID, di ba? Pero both of them can teach our body to make a response. Okay? Hindi ko na to pupuntahan. Pero sinasabi lang dito na may dahilan kung bakit po natin na-calculate ang 70% or 67 to 70% ng population dapat na bakunahan. Okay, number 2, tanong niyo din, which vaccines will we use? No? So, meron pong 7 bakuna na tinitingnan yung ating gobyerno. No? So, Astra, Gamaleya, Janssen, Moderna, Novavax, Pfizer, at Sinovac. Pero, sa lahat ng ito, 2 pa lang po yung may emergency use authorization at sa lahat ng to, 2 doses sila, yung Janssen lang yung 1 dose. No? So, siguro ang tanong nyo, bakit 7? No? Bakit kailangan natin ng 7 bakuna? Well, 80% kasi ng supply ng bakuna sa buong mundo ay kinuha na po ng mayayamang bansa. No? So, tayo ay naghatian with other countries dun sa 20%. Sabi niyo, bakit nila nakuha yon? Well, kasi habang pinadevelop pa lang yung mga bakuna, nagbigay na ng malalaking pera po itong mayayamang bansa para tumulong po sa research, no, ng mga bakuna. Eh tayo naman, hindi na natin yun afford, no? Because that's a big risk. Kung hindi po maging successful yung mga trials, edi sasabihin po sa atin, oh, naku, bakit tayo nagbigay ng pera? No? So tayo ay naghintay habang din-develop yung mga bakuna. So ngayon po, na meron na po vaccines that are eligible, we are negotiating with them. No? So dahil marami-rami tayo sa Pilipinas, 110 million, kailangan po iba-iba yung posibleng magbibigay sa atin. No? Kasi paunti-unti na lang yung kaya po nilang i-produce. So gusto ko rin pong sabihin sa inyo at i-assure kayo na ako po, kahit nagbabasa po ako about all of these vaccines, ako ay panatag, no? Panatag yung loob ko kasi meron pong 5 expert groups na iba-iba po ang tinitingnan nilang aspeto ng vaccine at vaccination program, no? And there are 5 expert groups coming from the best clinicians, scientists in the country. Some of them practicing, some of them in the laboratory, some of them in research, diba? And some of them teachers, no? In our top academic institution. All of them are looking at safety, efficacy, cost effectiveness, equity, no? Yung lahat ng aspeto ng pag-roll out ng pagbabakuna. So, hindi po natin kailangan mag-alala. Once nakakuha siya ng EUA, regardless kung anong brand, makakapag-panatag ang loob nyo dapat na na-check siya talaga ng mabuti. So, marami pong stages po, no, yung development and approval ng isang bakuna. Nag-umpisa siya sa mga animals, tapos sa konting tao, sa padami na tao, hanggang sa libo-libo na yung sumasali. So, preclinical, phase 1, phase 2, phase 3. Dati po, tinatapos natin, tapos ang phase 3 bago natin ginagamit, no, ang isang bakuna or gamot. Pero ngayon, dahil may pandemya po at milyon-milyon na po ang namatay, mas maaga po natin siya gagamitin. No? So dito sa next slide, makikita nyo, kapag hindi pa po tapos, no, yung mga clinical trial na phase 3, EUA po yung binibigay. Kapag tapos na po, Certificate of Product Registration. Ito po, mahalaga, no? Gusto ko pong i-emphasize sa inyong lahat. Ano po ibig sabihin nito? Ang ibig sabihin po, dun sa taas, dun sa Emergency Use Authorization, hindi pa tapos yung development ng bakuna. Pero alam natin, base sa datos, safe siya at efficacious siya. No? Kaya, dahil may emergency, kaya yung benepisyo, mas malaki kaysa sa risk, gagamitin po siya. No? Kaya EUA lamang yung kanyang permiso. Gobyerno lang ang pwedeng mag-administer ng program. Sabihin nyo bakit? Kasi it has its corresponding risk and the companies are not going to be liable for it. It's the national government that's taking responsibility for it. And this is why, later on, kung meron kayo sa mga chat group na sinasabi, uy, bumili kayo ng bakuna sa kung saan-saan, matakot kayo. No? Kasi wala pong commercial lisensya tong mga to. Ibig sabihin, saan nyo man yan nabili, hindi nila kaya kayong panagutan. No? Only vaccines coming from the national government, dun lang kayo mapapanatag. Next, dito po sa baba, dun sa Certificate of Product Registration, ito po yung karaniwan. No? All other bakuna na meron tayo sa bansa, yung mga flu vaccine, CPR yung meron sila. Ibig sabihin, tapos na po yung pagsasaliksik sa kanila. Tapos na yung clinical trial. And if tapos na, kung may mangyari sa pasyente, sinasabi ng kumpanya, okay lang, liable ako. Pwede mo akong hablahin. Pero dito sa EUA, hindi, no? Kapartner ng kumpanya, yung national government sa pag-roll out ng bakuna. Kasi under study pa ito. Okay? So, nilagay ko po dito, bigay naman po namin yung copy ng slides, yung iba-iba pong brand, no, ng bakuna, at ilan yung mga doses niya. Kita nyo po dito, 1 dose lang po yung Janssen. Next, sa temperatura, kita nyo po, no, karamihan sa kanila, kaya ng 2 to 8 degrees Celsius. Yung 2 to 8 degrees Celsius, yung parang regular natin na cold chain or refrigerator, no? So ito yung pwede natin gamitin na sa mga bakuna natin dati. Pero yung iba po sa kanila, like Moderna at Pfizer, kinakailangan na mas malamig, no, yung temperatura. So dahil kailangan nila ng mas malamig na temperatura, pili lang po yung lugar na pwede po silang dalhan. No? So ano yung mga lugar na yon? Yung mga may super lamig na refrigeration. So siguro kung nakita niyo sa balita, last week and 2 weeks ago, si Secretary Duque and Secretary Galvez has been going around, no, some of these plants to really look at gaano ba kadami yung bakuna na kasyang i-store doon, no? Pero kapag Pfizer at Moderna yan, likely po hindi natin yan madadala sa probinsya, no, sa liblib na lugar. Kasi doon, yung mga bakunang 2 to 8 degrees Celsius, yung likely gagamitin natin. Kita nyo rin po, no, sa last column, wala pong mga contraindication. Ibig sabihin, as much as possible, magbibigay po tayo ng gamot, ng bakuna sa lahat, no, except those with severe allergic reaction. Meaning, yung mga tao na nagkaroon po ng history na kapag may ininom na gamot or nilagay sa katawan nila, yung hindi na talaga sila makahinga na allergy. Pero yung allergy na, kapag kumain ako ng hipon, nangangati ako ng onte, pwede pa yon, no? Pero yung kumakain ng ganon, pero talagang hindi na sila makahinga, sila yung medyo kailangan i-reassess ulit kung kailangan bang bakunahan. Okay? Ito po galing kay DG Eric Domingo, no? Pinapakita lang na 6 na yung brands na nag-apply po sa ating bansa. At 2 pa lang yung nagkakaroon po ng permiso. So, tanong nyo, kailangan nyo bang magbayad or libre ba yung bakuna? Ang sagot po ay hindi, no? Ang ating directive po ay dapat 100% free yung bakuna. Meron po mga tripartite agreement, yung private sector kasama ang gobyerno, but they're only supposed to provide to their employees, but for free, no? Hindi rin nila pwedeng singilin. So, marami po tayong reasons, no, kung bakit tayo nagbabakuna. Pero, dahil konti po yung stock, kailangan po natin i-prioritize, di ba? So, pag nagpa-prioritize tayo, kailangan alam natin ano yung dahilan, no, bakit sino yung dapat mauna. So, dito po sa primary goal, nakalagay po, we need to maintain most of the critical essential services, including health, for example, di ba? Ibig sabihin, we need to know that yung health system natin, hindi siya babagsak, no? Kung biglang dumami yung kaso, etc. There also needs to be direct reduction ng mga namamatay. Diba? Yan ang unang-unang goal natin. Then after, our other goals are to control transmission, minimize disruption, and resumption to near normal. So dahil dyan, ito yung mga mauuna, no? Frontline health workers, seniors, those with comorbidities or may sakit, frontline personnel in essential sector, and indigent population. Next would be priority group B, teachers, social workers, etc., etc. No? Bigay ko na lang po ito sa inyo. So, pag tinanong niyo naman, okay, operationally, paano po yun? So, kunwari, kailangan natin din i-balance yung grupo sa kung nasaan sila, tsaka ano yung sub-priority. So, kunwari, sa healthcare worker, no, pare-parehong doktor or nurse. Yung isa nasa Manila na maraming kaso, yung isa nasa Batanes, walang kaso. Siyempre, mauuna yung nasa Maynila, di ba? Second, among health workers, uunahin mo ba yung doktor na nagte-teleconsultation lamang? No? Yung dito siya nag-uusap sa phone, ay sa internet? Or uunahin mo ba yung doktor na humaharap talaga sa pasyente? So, dahil mas mataas yung exposure, yun yung uunahin mo. No? So, even within a priority group, meron po tayong inuuna. In the same way, among teachers, likely mauuna po yung mga teachers na nasa areas na matataas yung risk, di ba? Kumpara sa teachers na mga nasa areas na mababa yung kaso. So, number 5, when and where will I get vaccinated? So, ang sagot dito is depende siya, no, kung nasaan kang priority group. Pero ang kailangan mo talagang pakinggan na announcement ay si mayor or si governor, di ba? Kasi sila talaga yung magiging in charge. So, unlike po kayo sa DepEd, kayo po ay centralized, di ba? Kami po sa DOH, devolved po kami, no? Ibig sabihin, most of the operational work are being done by the LGUs. So, dahil po doon, yung LGUs po talaga yung mag-i-implement, no? So, kunwari, yung pagpapalista po sa inyo, si LGU po bahala. Si LGU po magsasubmit nung lista sa amin. Tapos, kami lang po yung magbibigay sa kanila. Okay, 100,000 ba yung nalista? Bigay namin sa inyo, no? Pero si LGU magpaplano kung saan kayo babakunahan, etc. Next important thing is, ang klaro po sa atin ngayon, basta mauna lahat ng health workers at mauna po lahat ng senior citizens, pwede na po sabay, no? Sabay ng gagalaw yung national government at LGU and private. Pero hanggat hindi pa tapos yung frontline at senior, hindi pa po pwedeng makapag-umpisa pharmacy private. So marami pong vaccination post, no? Again, si LGU po ninyo mag-a-announce kung saan kayo babakunahan, aling eskwelahan yung gagamitin, etc. Tanong nyo, bakit, no? Hindi ba mag-house to house na lang? Hindi po, no? Related sa kwento ko po sa inyo mamaya, kailangan nyo pong malaman na kailangan tayong maobserbahan between the first hour ng ating pagbabakuna. So, if in-injectionan kayo ng 1 o'clock, 1 o'clock to 2 o'clock, dapat nandun po kayo sa vaccination center. Eh kung umiikot yung health worker sa komunidad, wala pong mag-o-observe sa inyo. No? Kaya ang tawag po natin ay fixed post-vaccination strategy. Kasi lahat ng mga reactions, karamihan sa kanila nangyayari sa first hour. At kaya kailangan maobserbahan kayo dun sa first hour. Okay? Ito, hindi ko na po siya totoxikin. All it's saying is, hindi po to pupunta kayo sa araw na yon sa pagbabakuna. Kailangan po pre-registered kayo. Okay, ito yon. So, una, mag-register kayo. Again, the registration is through your LGUs. So, sabihin nyo, ano ba, di magkakaiba, no? Paano kung mag-register ako sa Taguig? Mag-register din ako sa Parañaque, ganyan. Pwede kayo mag-register sa lahat, pero malalaman po kasi isang sistema lang po yung gagamitin namin sa likuran, no? So, each individual will have your own unique code, no? So, then you will receive pre-vaccination counseling and a consent form process. Then you will also need to get screened or profiled. Ibig sabihin, alam ko ano yung mga sakit na meron kayo. Then finally, babakunahan kayo. And then after pagbabakuna, you will be there until 1 hour. So, ano yung mga kailangan yung gawin bago magbakunahan? Obtain accurate information only from the right sources. Always verify what you read and hear. And declare your complete medical history. Huwag na kayong magtago, no? Yung iba sa inyo, huwag nyo naman sabihin na, oh, may allergy ako kahit wala kayong allergy. So, kailangan nyo sabihin yung totoo or yung kabaliktaran, no? You need the doctor who's screening you or the nurse screening you needs to know the real information. So, can you choose the brand? No, no? So, kung nakapila na kayo doon, kung ano yung dumating at that time, yun po yung brand na gagamitin. Pero pwede ba kayong magsabi na ayaw nyo? Yes, of course, no? May freedom pa rin kayo. Pero, alamin nyo lang na kapag humindi na kayo, kailangan nyo mahintay, no, matapos yung entire priority group bago kayo pwede ulit mabakunahan. Kung biglang nag-change na yung utak nyo. Next, will a person receive the same brand? Yes po, no? Hindi pwedeng, first dose ko Pfizer, second dose ko Moderna. Hindi pwedeng ganon, no? Dapat isang klase lang. Kung naka-COVID na kayo dati, kailangan pa ba? Based sa guidelines natin ngayon, oo. No? Kasi kapag natural infection, mabilis po mawala yung inyong protection. No? And do you need to get tested before vaccinated? No, no? Pero syempre, kung may sintomas kayo na feeling nyo may sakit kayo, hindi kayo dapat pumunta on the day of your vaccination. Diba? You just need to call and say, it seems like I have symptoms. So, para hindi kayo makahawa dun sa lahat ng magpapabakuna. Okay? So, what do I need to do during vaccination? Punta doon, on time, and sign the informed consent. Bibigyan po kayo ng vaccination card na may QR code like this, no? So, hindi to pwedeng, hindi nyo siya makukuha itong card na to, yung authentic na card, kapag hindi mo kilala, no? Kung hindi LGU yung nag-organize nung inyong vaccination campaign. Next, you can go home within 30 minutes to 1 hour at tandaan nyo, i-monitor yung inyong adverse events until 1 year after you are vaccinated. No? So, dapat maayos po yung ating pag-coordinate with our healthcare professional. Next, number 8, what do you do after vaccination? No? So, usual symptoms may be experienced. Ito yon. No? So, medyo mamamaga, masakit, mapula, tapos pwede siyang maging headache, fever, or parang napapagod ka, no? Normal ito, no? This is normal and it's part of your immune system telling you, oo, gumagana ako, no? So, gumagana ako. Pero, Gusto ko rin po ito kasi teachers tayo dito, no, mostly in the education institution. So we need to know what are the differences in terminologies. First, side effect, no? Any unintended effect of the product, including vaccine. So yung kanina, ang tawag po dito ay side effect. Alam natin, no, na mangyayari yan. Merong adverse event, no, following immunization. Ito yung mga hindi natin sigurado kasi hindi siya lumabas sa any of the studies. Kapag may adverse event na nangyari, nahimatay, whatever, kailangan, bago mo masabi, dahilan siya nung bakuna na yon is na-establish yung causal, no? Causal relationship. Hindi pwedeng haka-haka lang na, siguro dahil binakunahan kaya ganun. No? So may nag-aaral nun. And then yung certain types of adverse events are serious kung it results in deaths, mas na-hospital ka, mas matagal, etc. So, meron tayong expert group committee na nag-aaral lang talaga nito. So, kunwari po, sa lugar nyo, sa barangay Pag-asa, kunwari, may nabakunahan. Tapos, after 30 minutes, bigla siyang, ano nangyari, no? Nahilo, ganyan. Kung wala yung sintomas na yun sa listahan ng expected, i-investigahan to. No? So, investigahan ng experts at the regional level. Tapos, kapag na-realize na, ay nako, ano lang pala, hindi pala nakakain ng tama, ang tagal kasing naghihintay, no? Kinakabahan, ayaw. So, baka hindi kasi siya reason, no? Hindi siya related dun sa pagbabakuna. So, dito po, sinasabi din natin, no, sa slide na to, na iba-iba po yung types of reaction na pwede mangyari sa iyo. So within 50 to 30 minutes, usually lalabas na lahat kung may allergic reaction ka, including anaphylaxis or yung delikadong allergy, di ba? Pero yung mga vasovagal reaction within 15 minutes, tapos yung mga side effects na sinasabi natin kanina, yung pamumula, pamamaga, at saka nagkaka-fever, pwede yan 1 to 3 days, no? After vaccination. Pero even with everything, tuloy pa rin yung second dose mo. Hindi ka lang tutuloy ng second dose, lalo na sa Moderna at Pfizer, kung nagkaroon ka ng allergic reaction, no? Ng severe allergic reaction. So dito nilagay ko lang, no, kung ano yung mga klase ng sintomas that constitute a regular reaction, no? So dito tingnan mo, pallor, namumutla, diaphoresis, lagi kang napapawisan, no? These are regular reactions from vaccination na we just need to expect, di ba? Some people feel it, some people don't. So I'll leave it at that. So after vaccination, you just need to make sure that you finish the 2 doses and complete the second dose, even if you experience some of the symptoms that I've mentioned, unless a health worker tells you not to get the shot. No? Unless you get expert advice na hindi nyo gagawin yung second shot. Health authorities will also investigate kung coincidence lang ba yung nangyari or talagang may causality, diba? So after vaccination, can you go back to not wearing face mask and shield? Siyempre hindi, no? At gusto ko ipakita sa inyo itong dalawang types ng parang way to explain it. Una, itong Swiss cheese model, no? Na sinasabi, lahat ng ginagawa natin, nagpapatong-patong, no? Kailangan layers of protection, and vaccine is just one of the layers of protection. Kung ayaw nyo naman to intindihin, eto naman, no? Simple lang. Ayokong makagat ng lamok. No? So, di ba, nag-ano tayo, insect repellent. Pero, hinahabaan mo rin yung mga suot mo, no? Nag-long sleeve ka, nagme-medyas ka. Ay, kulang pa. Lagyan natin ng screen yung mga bintana natin. Ay, kulang pa. Naku, matulog tayo sa ilalim ng kulampo. Ay, kulang pa. Maglagay tayo ng katol. Di ba? So, ginagawa naman natin to sa iba pero hindi naman natin sinasabi dito sa mosquito na, ay hindi, screen lang pwede na, di ba? So we layer up our protection. And I think this is the same way that we're being asked, no? So you still do your mask, physical distancing, hand hygiene, etc. In order for us to actually win over the pandemic. Okay? And number 10, This is a call, no, to everyone that you need to ensure that your vaccines are real and they're still effective, no? At two factors yon. Dapat na-check sila ng FDA at second, dapat assured kayo na dinala sila ng maayos, no? Meron po actually, ma'am, mga nagtanong sa akin, paano kung may kamag-anak ako galing Amerika, uuwian nila ako ng Pfizer na gamot, na bakuna, okay ba yon? So, kailangan ko sabihin sa inyo, tandaan nyo, ang Pfizer, sinabi ko kanina, di ba, negative 70 degrees, kailangan. Sa tingin nyo po ba, may negative 70 degree na freezer sa maleta ng mga kaibigan nyo? Wala. Likely no, di ba? So, ibig sabihin po, kahit nauwi niya po yung bakuna na Pfizer, whether it's a real vaccine or not, yung mas nakakatakot doon ay, Diyos ko, hindi pa ba yun nasira, di ba? At baka pag in-injection sa inyo, baka kayo pa ay lalong malagot. Okay? Finally, pinapakita lang po no, na magkakaiba po yung types ng refrigeration na kailangan. At ito yung dahilan kung bakit nag-work yung ating government with private sector entities to make sure that the vaccines, when delivered here by the international manufacturer, maalagaan natin yung cold chain na tinatawag. The moment na nawala po sila dun sa lamig, pwede pong sira na po sila. No? Okay? So I think I will end my presentation there. Tara na po tayo sa Vida Vaccination. Thank you.
There. Thank you po to our speaker, Director Beverly Ho. And now, once again, I would like to welcome Director Ronilda Co and Sir Bonimar Lumabaw.
Thank you, Lily. Doc Beverly, maraming salamat po para sa kaalaman ng lahat ng nanonood. So, po natin si Doc Beverly. DOH has been really very generous po sa time nila lagi sa atin. Ano? So, thank you po, Doc. Doc, i-link ko muna yung mga ilang sinabi nyo doon sa kay Dr. Gloriani muna kanina. Kasi may binanggit si Dr. Gloriani nga doon. So, sabi nyo kasi may 7 vaccines no, available for us. No? Na kumbaga yun yung marami dahil yun na lang yung natitira sa sandaigdigan. So, diba? Para sa iba't ibang bansa. No? Ngayon, may binanggit po kasi siya doon sa trial kanina na parang ang ito-trial lang natin dito ay yung sa Sinovac sa elderly, parang ganon. Kung tama po ba yun? Kasi ang tinatanong nga parang given all the side effects na na nakikita na iba-iba rin ang interaction ng vaccine sa iba't ibang klase ng population, yung may comorbidities, yung matanda, yung ganon, yung yung mga pregnant, yung mga ganyan, or kaya yung poor ang nutrition. So it's a try po ba natin or yung pagkasabi ni Dr. Gloriani sa Sinovac lang po ang trial?
Ma'am, yung question niya po is whether yung sa Sinovac lang ba ito-trial? Sorry po.
Kasi yun ang nabanggit ni Doc Gloriani kanina. Kasi yung sa pito, bago natin siya i-roll out. Di ba? Parang ganon. Parang trial ba tawag doon, Doc? Para makita muna natin bago natin siya i-roll out talaga sa population. Yun po ang
So, bale po, different po yung clinical trial sa actual rollout, di ba, ma'am? So, yung clinical trial po, meron po mga brands na hindi pa po talaga sila binibigyan ng EUA, no? So, nandito po sila sa bansa natin para po magkaroon ng clinical trial. So, may specific groups lang ng population yon, may recruitment process yon. Pero most yung pinakita ko po na 7, sila po ay kung mabigyan ng EUA, mag-undergo na sila ng deployment. No? Ibig sabihin, sila po yung gagamitin dun sa mga pagbabakuna sa atin.
Okay. So, ibig sabihin, ma'am, yung mga nag-grant na, Doc, yung mga nag-grant na, nakatrial na actually sila?
Yes po, no? Pero sa lahat po, kahit nakapag-trial na sila, hindi pa sila lahat tapos ng phase 3, no? Kasi usually, yung phase 3 po, para malaman po natin yung long-term effects niya, di ba? Parang kunwari yung tanong, hanggang gaano po katagal yung protection ng bakuna? Hindi mo kayang sabihin na 5 taon yung protection ng bakuna kasi yung mga trials natin, hindi pa naman tumagal ng 5 taon, di ba ma'am? So, but at this point, dahil kailangan natin sila gamitin, yung safety profile niya and efficacy profile for the short period is enough for us to say we want to use it, no? So, kunwari yung Pfizer, kahit po gagamitin na siya at ginagamit na siya sa ibang bansa, tinutuloy pa rin po nila yung trial, no? Sa ibang bansa. Hindi kasi siya nag-trial sa Pilipinas. Tuloy-tuloy pa rin yung trial. Paano yun? Pina-follow up pa rin nila yung mga pasyente. Kasi gusto nila, habang tumatagal, masasabi nila sa atin na, oh, okay, as of now, 1 year na po yung trial namin. Mukhang 1 year, tumatagal yung immune response. Kapag ituloy-tuloy pa nila, next year, masasabi nila sa atin na, chinek ulit namin yung mga nasa trial. Parang okay pa sila. So, ibig sabihin, yung knowledge at that time is, 2 years pala. Pwede, di ba? So, siguro yung gusto lang din po natin ma-emphasize dito sa lahat is, as much as we always want science to be precise, di ba? To be very exact, science is also evolving, no? Kaya as we learn more about the vaccines, we will also let you know more about the vaccines din po.
Sige po. Siguro i-follow up ko lang yan. So, Doc, kung doon sa mga na-approve na ng yung EUA, sabi mo na trial. So, na-trial siya sa bansa. Kanino po siya mga groups na trial? Para lang po, mga kampante rin ang mga nakikinig. Nakamute si Doc? Yes.
Okay. Sige po. So, yung mga trial participants po, usually yung Asians po, no? So, tayo part ng Asians, we constitute less than 10% of most of the trials that have been done in US, di ba? And in Europe, no? So, yan yung mga Pfizer, AstraZeneca. But even so, because ang bilis nga na marami yung population, so that 4% of a usual 30,000 or 60,000 participants is a few thousand din po, no? So, marami-rami rin naman po tayo doon. So, that's, yun po, ma'am.
Okay. Doc, doon tayo sa sa sinabi mo kanina na yung sa transmission, kasi yung na-prevent yung transmission. Pero may nabanggit din po si Dr. Gloriani na merong posible na yung vaccine failure. So, hindi rin 100% na pwedeng sabihin na ang na-vaccinate na tao ay hindi na siya nakakahawa, something to that effect. Pwede pong palawigin din ninyo yon or
I'm sorry, can you clarify na pala ako ng konti?
Doon po sa yung pag-prevent ng transmission, parang sinasabi, meron din naman tinatawag na vaccine failure. So hindi siya 100% na posible na meron din may mga nangyayari, though very small ang sabi ni Doc Gloriani na pwede ka pa rin makahawa later on, yung ganon. So
yes, ma'am, no? So as it is, 'di ba, wala talagang 100% perfect no na product, 'di ba? So doon po sa pinakita ko sa inyo, 'di ba? In each of those, yung naging kuting, yung naging bungo, 'di ba? Yung preventing transmission, lahat po 'yun, no? May range po, no? So hindi siya perfect na lahat 100% protection. Kaya this uncertainty is still telling us, no, we need to do mask, iwas, hugas, 'di ba?
Doc, doon sa kasi may dalawa kayong doses na sinasabi nga, no? Paano po pag ang isang mamamayan natin, di ba, hindi naman niya nakuha yung second dose. Yung bang effectivity, kasi may pinakita na first dose may effectivity na siya at lahat, aandar pa rin po ba yun?
So, tandaan po natin, no, ma'am, dahil yung EUA, no, yung permiso nila, di ba, ay sinasabi natin, nakakuha sila ng permiso because the benefit outweighs the risk, di ba? Ibig sabihin yung benepisyo or your protection is higher than the risk. But that protection was calculated based on the 2 doses, di ba? So, that also tells us that if we don't follow the indication, then the benefit might actually not be greater than the risk, di ba? Kasi we might not get the whole protection. So, the advice really is you follow. Kung 2 doses yung dapat mong kunin, dapat 2 doses. And hindi ka lang kukuha nun kapag after the first dose, you had a severe allergic reaction po.
Doc, kasi kasi may interval yon, di ba? First and second dose. Paano po pag halimbawa hindi siya nakarating sa araw na yon for some reasons, ganyan. Meron po bang extension yung intervals na yon para makahabol pa rin siya at may effectivity pa rin po? Nakamute si Doc. Nakamute pa si Doc, yes. Ayan.
Actually, ma'am, may allowance naman po no, na binibigay. So, recently, nagkaroon sila ng, dapat ang advice is the nearer no, to the date dapat. So, you will actually be given your schedule. At syempre, kung one day after, parang acceptable naman yon, di ba? Pero ang sinasabi nila, as much as possible, you don't want to delay it. No? So, syempre, may protocols naman na gagawin kapag nag-schedule kayo at nabakunahan kayo, and within the LG, magagawa naman yun ng paraan. It's just that as much as possible, we don't want people to delay.
Doc, bago ko rin tawagan si Bonnie, kasama ko magtatanong sa inyo, no? Ito pang tanong. Sabi niyo kasi 70 to 80% ang needed para magkaroon ng herd immunity. So ito po bang programa natin ng gobyerno ay ibig bang sabihin voluntary po ba ito at ilan po ang populasyon na tinitignan talaga na dapat ma-vaccinate po?
Dapat po ma-vaccinate, no? So, yun yung gusto natin. Kasi at this point, hindi na naman natin alam, no, who in the population has successfully had COVID. But also kasi, if you had COVID a long time ago, your immunity might have already waned, no? So, kaya din importante na shorter period of time, mas marami tayong mabakunahan. So, in a smaller extent, isipin nyo na lang po, kunwari, sa pamilya nyo, kung 10 kayo sa bahay, dapat at least 7 sa inyo, di ba, na bakunahan. Better, syempre, 10, no? So, sa komunidad nyo, ganun din, no? Sa classroom nyo, ganun din, di ba? So, let's make sure na everyone around us or who we're interacting with are all for this.
Meron po ba tayong parang halimbawa number sa populasyon, Doc, na inaay na ng government na ilang milyong ganito, dapat yun na vaccinate, yung ganon? Meron po bang ganong
based po sa plan, this year is at least 70 million no, should be vaccinated, Filipinos. So what will stop us from getting to this target lang po talaga is if, syempre, yung global stocks, no? Nakita naman po natin sa mga news, kahit yung mga European countries, di ba? May mga orders na sila, tapos na-cancelan sila, di ba? So tayo, we're hoping that lahat ng mga orders natin are all going to be delivered on time po.
Bonnie, may tanong ka kay Doc?
Yes, dear. Thank you so much. Good morning, Director Ho. May mga few questions lang po tayo from our participants. First question actually is in relation to the fear or the stigma brought about by the dengue vaccine. The biggest problem we are facing now is the stigma po na brought by dengue vaccine. Ang ano pa is, how can we remove daw po yung fear or that stigma para makapag-avail ang mga tao dito sa vaccination program natin? And in relation din nga po dun sa napapabalitang death ng mga nakapag-avail ng vaccine sa Europe.
So una po, no, dapat klaro sa atin lahat na yung mga may deaths na nangyari, hindi pa po tapos ang kanilang causal assessment, no? So at this point in time, there's no scientific evidence that relates the death to the vaccine per se. No? Parang dapat klaro yun sa atin. So they are being investigated now, no? Ano yung link, diba? So that's one. Second is, yung hesitancy sa atin na tinatawag or lack of vaccine confidence. Karamihan po, at least in our experience the last few weeks talking to health workers din, hindi din naman natin masisi, no? Because the scientific information is also changing, diba? But when we had town halls like this to clarify information to clarify the information with the healthcare workers, yung scores, no, from 50-something% at tataas siya ng 90%, no? Sa nurses, ganon din. And so that's why we're hoping, ma'am, through a mechanism like this, we can turn over materials to you, and you can, in fact, do a similar session like this to a smaller group, di ba? Kasi I think people need their answers clarified, di ba? People need to be reassured of the process. So we've had recordings now of sessions done by our different scientific experts. We can actually just share them with you. They're in small, like 10-minute chunks, di ba? And please feel free po to also let us know how we can collaborate, di ba? We can show those videos and then maybe just host the Q&A, di ba? Pero yun pa lang, no, marami na dapat naka-clarify. Hindi po yun kasalanan ng tao kung hindi pa siya sure. But we're here to provide the correct information. Pero gusto din po natin i-raise, no, Sir Bonnie, na ang pinaka-problema din natin ngayon is nauunahan din talaga tayo ng maraming fake news, di ba? So we ask everyone, tuwing may nabasa kayo, isipin niyo ulit muna na parang galing ba to sa DOH? Galing ba to sa at least US CDC kung international, di ba? Kung hindi, basahin niyo, pero wag muna kayong maniwala, di ba? And find a person who will help you clarify, di ba? Otherwise, go lang ng go lahat ng fake news sa atin.
Thank you, Doc. In relation to that fear nga po, no, na nararamdaman ng ating mga mamamayan regarding this vaccine at sa pag-avail ng ating vaccine, paano daw po yung mga nasa far-flung areas nga po natin? May doctor ba daw po tayong pupunta doon to check them muna before providing the vaccines?
Nakamute.
Okay. So, doon naman po sa far-flung areas, una, no, ang pinakaunang tanong is dadating ba yung bakuna doon? Yes, no? May cold chain ba doon? Meron. Kasi nagbibigay naman tayo ng bakuna para sa bata doon, no? So, it's the same. So, meron siyang lalagyan, lalo na kung AstraZeneca yon, hindi siya yung Pfizer type, no? So, meron, nilalagyan. Second is health workers. Yes, no? So, kailangan, hindi naman walang tao, di ba? So, every LGU is supposed to have their set of health workers. So, yung mangyayari ngayon is a question of gaano karami kung biglang sabay-sabay dumating yung stocks natin, di ba? So, we're expecting na may talagang matatapos na maunang lugar, no? Kasi hindi naman sabay-sabay. Buong year, all throughout the year, merong cases. And we can always do what we have done last year, no, sa COVID, which is nagpapahiraman tayo ng tao, di ba? So, para siyang mission, di ba? Pupunta doon, ilang araw, matapos yung lahat ng tao. So, that's something that is being worked out now kasi operational details na po siya, sir. Yes.
Pero Doc,
Yes, yes, dear.
Follow up ko lang, Bonnie, yung question mo. Kasi di ba sabi mo rin kanina, hindi naman lahat ng parang kumbaga yung mga geographically differentiation din yung prioritization. So yung mga hindi naman tinamaan, walang hindi nag-COVID or low risk ang COVID o Doc. So sabi mo kanina parang hindi naman masya mapasasama sa prioritization ba yun compared doon sa mga mas meron na. Hindi po ba ganun din yon? Kasi like yung far-flung, Doc, parang kailangan ba sila, kung wala naman interaction na, yun?
I mean, ma'am, we cannot assume, di ba? Kasi everyone is at risk at the end of the day. If we're gonna open up the economy further to how we want it to be before, di ba? Sobrang baba ng GDP natin, ekonomiya natin, and if we don't make sure everyone is vaccinated, then mahirapan po tayo, no? Kasi ngayon, yung premise lang na hindi sila na-affect ay dahil nag-restrict tayo ng travel, di ba? But this restriction of travel in Secretary Berna's report, di ba, is showing us that 80 to 90% of tourism is local tourism. No? Doon galing yung economy growth natin. So, kailangan mabuksan. Pero the only way para safely din natin mabuksan is to ensure na bakunahan po yung mga kailangan po.
Okay. So, ibig bang sabihin nun, Doc, Beverly, kahit yung mga so geographically lahat yan buong Pilipinas, kada region, kada province ganyan at lahat meron babakunahan diyan sa lahat ng buong Pilipinas, ipra-prioritize lang siya ganon.
Yung goal pa rin natin, ma'am, di ba, lahat mabakunahan, no? Pero because of the supply, kunwari assuming na may available po na 110 million doses now na, talagang lahat naman tayo mababakunahan, di ba? Except yung mga bawal, no?
Yeah.
Yung mga contraindicated. Pero dahil po limitado, then we had to prioritize, no? So you're correct. If in case na kunwari dumating lang this year ay 30 million doses. Fine, 60 million kasi 2 doses per person, di ba? So 30 million lang yung kaya nating mabakunahan. Likely po dun sa far-flung areas na napakababa ng cases ng COVID, likely hindi po sila yung mauuna, no? Pero yung kahit gaano ka ka-far-flung, na may senior citizens ka at may healthcare worker ka, mapupuntahan yon. Kasi yun yung non-negotiable natin. Everywhere in the country na health worker at senior, dapat mauna po talaga. Pero thereafter, doon na po magkakatalo na, nako, baka June na ko, yung iba September, yung iba ay siguro January 2022 ka na. Parang ganun.
Siguro balikan ko lang yon Doc Beverly, kasi kanina na-discuss ni Dr. Gloriani na may interaction din ang vaccine sa katawan ng tao in terms of one, genetics, yung genetic makeup. Second po, yung immunity mismo ng tao, yung kalagayan niya. So halimbawa po, dun sa talaga na may mga comorbidities, gano'n, kasi ito rin yung tinatanong, na matatanda na elder, kasi sinasama natin sila. Ano pong masasabi nyo doon? Kasi yun nga, di ba, mas may interaction na mas posible, hindi kayanin ang side effects. Yung parang kailangan po ng clarity sa ating mga mamamayan tungkol dito, Doc.
Yes po. So, ma'am, parang klaro sa atin, no, that the topic is not going to be easy to explain to the public. And perhaps the reason why you may not really have seen a very public campaign on this yet is because inuna din talaga natin yung health workers. No? Mm-hmm. So, we're basing our strategy on our studies, diba, previously. Ano po yun, no? Na ang main nakaka-convince sa mga tao sa pagbabakuna ay syempre health authority and doctors, no? Doctors, nurses, they're healthcare workers. Then after nun, tsaka papasok yung relatives nila, friends nila, di ba? So last year din, sa COVID, we had this experience na the healthcare workers were telling us, kasi ang bilis din ng information last year, di ba, ma'am? The healthcare workers were telling us, nag-announce kayo DOH sa public. Pag-announce nyo sa public, kami naman yung tatanungin. Hindi naman namin alam pa, no? So, the strategy the entire last 2 months was really engaging health workers, no? They have to be convinced because yung ayaw mo mangyari tayo, DepEd, DOH, ito sinasabi natin. Then, everyone else will go to their local doctor and their local nurses, and they're like, nako, huwag kayong maniwala dyan, di ba? hindi rin natin yun afford, no? So, dapat at all levels, sa atin, national, pero lahat ng channels sa pupuntahan nila, na interpersonal channels, know how to answer their queries, no? So, now we are partnering, no? We have partnered with the main healthcare associations, and yung commitment din po nila sa atin ay sila po ang nagta-town hall na, no, among their regional chapters. And because they did this, all of you, no, so kunwari yung school district nyo gustong mag-invite ng certain resource person, basta PMA yan, Philippine Medical Association, Philippine Nurses Association, Philippine Pharmacists Association, or Integrated Midwives, nanggaling na po sila sa admin, no? So may materials nila, ay materials din natin, no? So mabilis na. So at your level, kahit maliliit na meetings, kaya na natin itap, no? So buong bansa tayong nag-champion on this. Ma'am, gusto ko lang din siguro i-take itong opportunity to mention na we have a partnership with AKAP Guro Connected, no? So I think you're familiar with this. And sige ma'am, siguro kayo na lang din mag-a-announce, but eventually we're hoping na tuloy-tuloy, no? Through this partnership, magkaroon ng series of town halls tayo with our teachers.
Salamat, Doc Bev. Oo. Siguro, Bonnie, meron ka pa bago ako ulit kay Doc Beverly?
Yes, dear. Another question from our PACs, from our participant. Since voluntary daw po ang pagpabakuna, no? Sakali pong ayaw ng isa, no? Ang magpabakuna and then he or she got contacted with the virus, may financial assistance daw po ba ibibigay ang gobyerno?
Sorry. Yes, no? Kasama po yun, yung parang indemnity fund na tinatawag, di ba? So, kung ano man yung mangyari, syempre, no? Kailangan i-cover siya ng government kasi government nga yung may authority dito. And in the same way, kung hindi mo alam kung saan mo kinuha yung bakuna mo, don't get yourself injected kasi no one will account for that, no? Yun lang din yung kailangan nyo maalala. So if you get it through your LGU, that's likely the national government stocks. That's valid. You will get the card. Whatever happens, sagot kayo, no? Pero kapag hindi kayo sure kung sino-sino naglako sa inyo sa online, please, wag lang po kasi masyadong delikado. Thank you.
Doc Bev, yung pong kasi sabi nyo kanina LGU kasi ang mamamahala. Pero ang bibili ang national government, ganun din po ba? Kasi nababalitaan din natin na may mga LGUs din na parang sinasabi na sila kumbaga nakipag-usap na sa mga nag-produce na bibili sila. Ano po ba talaga yon? Paano po ba yung bilihan nito? Sino ang allowed bumili? At siguro karugtong ng tanong na yon, Doc Bev, so lahat tayo kahit ang mga government employees, ganyan, di ba? Tayo ay nagre-register po doon sa sarili nating tinitirahan or pwede po ba ang place of work? Parang ganon. So yun po.
So sa atin po, currently, sabi ko nga sa inyo, di ba, yung private companies na gumagawa ng bakuna, ayaw actually nila kumausap sa private, no? Kasi it's the private companies. Kasi it's the national government that's taking responsibility for it. Kaya kung papansinin nyo, yung nature po ng kontrata is tripartite, di ba? At hindi yun dahil pinipigilan ng national government yung private or yung LGU. It's just that the companies want the government, the national government, to be their contracting party. Napasok lang po yung private or yung LGU to provide additional financing, no? So, sa lahat po ng LGU, syempre, di ba, matatakot din naman sila kung saan sila kukuha, no? So, kumakontrata din sila sa kung sino lang din yung kakontrata ng national government, no? So, we're all getting, like, whatever stocks na legitimate na dadating sa Pilipinas, yun yung ipa-facilitate po ng team ni Sec Charlie and everyone, di ba? Dito sa DOH, no? So, kung ano man yung i-inject sa inyo ng LGU, tsaka ng mga legitimate na private, no? So, ilalabas rin po ng listahan, no? Sino yung mga kumpanya na talagang sumama doon sa tripartite para alam ng mga tao, yun yung legitimate. So, yun po, galing po sa national government. So, pag dinala po sila dito, ang magbibilang, mag-check noon FDA, no? Yung team nila, Sec Charlie, mag-help mag-deliver noon. No? Military yung mag-help mag-deliver noon. At mga private logistics supplier. So, pag na-deliver yon, ang mag-i-injection, mag-facilitate ng injection ay LGU, no? So, only in cases where the LGU will say, kunwari, LGU of Taguig, no? Medyo may kaya sila. Sabihin nila, gusto namin yung St. Luke's kasama sa vaccination center. So, sila LGU na ng Taguig yung magbabayad sa St. Luke's para magamit niya yung mga lugar nila, di ba? Pero hindi yun yung case sa lahat. Kasi maybe an LGU in, I don't know, Camarines or something, they will decide na, ay hindi, our basketball court yung gagamitin natin, di ba? Or yung convention center. Kaya sinasabi ko po sa inyo kanina, listen to the instructions coming from your governor and mayor because the specifics will come from them. The specific venue, the specific date, etc. No? So we will, the national government will coordinate with the LGUs. So every time may shipment na dadating, ano yun, i-allocate siya, di ba? At yung allocation is central, no? Para alam saan siya mapupunta. So hindi to sabog-sabog, no? At by the time din na nag-allocate tayo, na double check na rin. Double entry ba? Dalawa bang Ronilda ko yung nagkukuha ng bakuna in this round, di ba? So may checking po na mangyayari. No? So that's central. But once that's checked, alam na natin, LGU1, 100,000, LGU2, 500,000, ganyan. Once na nabigay na, sila na po yung mag-administer. Sila na rin po magmo-monitor sa inyo.
Doc Bev, kasama na doon yung yung parang kumbaga sabi nyo dagdag nila na financial na dagdag sa national government na pera, yung parang idadagdag ng isang LGU. Parang nakaano na din po doon. Doon sa
Opo. Kasi actually, ma'am, nasa balita lang sila, no? Pero konti lang yung LGU na may additional money kasi to do it, di ba? So talaga mostly the money came from national government naman. At yung sinasabi din natin kasi, yung nakikita natin na cost ng bakuna, hindi lang yun yung cost, di ba? Alam natin to, yung sa education, di naman libro yung cost, di ba? Yung entire operations yung mas malaking cost. So, ganun din yung sa atin. So, we are actually encouraging the LGUs, sige, hayaan nyo na, parang the national government will be able to source the money for that vial. But the LGU will have to find the money for, pagkain ng mga vaccinator, di ba? Yung mga small things that add up, no? Yung mga PPE, di ba? Magbibigay naman yung national, pero syempre dapat handa, di ba? Yung LGU. Tapos yung kuryente dun sa lugar ng vaccination, all of these adds up. Finally, mga poster, brochure, we can provide the template, di ba? Soft copy. Pero kung ipiprint pa natin dito sa national, ipapamigay sa buong bansa, hindi siya matatapos, di ba? So those are the counterparts that we are expecting all the usual LGUs. But if the LGU is mas libo, mas may pera sila, etc., by all means, dagdag sila ng konti pang pera for vaccine. Pero hindi talaga, ma'am, sila pwede rin diretsong bumili. Talagang lahat ng binibili nila dadaan kay Sec Charlie po.
Sige. Bonnie, may ano ka pa kay Doc? Meron pa dyan?
Actually, one last question siguro dear. Regarding sa atin sa DepEd, the mga non-teaching personnels natin sa DepEd. I don't know if the question will be answered by Dr. Ho. What are the clear plans daw po ng DepEd regarding sa COVID-19 immunization ng ating mga non-teaching personnel sa region and up to the division or school level?
Nakamute si ma'am, si Doc.
The question is more DepEd, no, sir?
Oo.
Yes, Doc.
Medyo mas DepEd. Pero do you want to say anything before I say something?
Actually, ma'am, from our end, kasi parang clear talaga na yung deployment is through LGUs. So, I think even for DepEd, di ba, parang yung mag-implement kasi talaga nito, hindi naman tayo, not our two agencies, di ba? And then finally, kung private man siya, the private have already been instructed also na they work with the LGU. So, kunwari, I would assume ito parang DepEd lang, di ba? Kunwari, ako ay isang big conglomerate A, no? Ako ang conglomerate na meron akong branch sa isa sa Quezon City, isa sa Cebu, isa sa ano. Hindi rin ako kakausap sa national government eh. Yung empleyado ko na nasa Cebu, ang kakausapin ko Cebu local government. Yung empleyado ko sa Davao, kakausapin ko. 'Di ba? Kasi locality siya. Kasi gusto natin at the end of the day, yung maging responsible po for monitoring for the next 1 year ay yung local authority doon. No? So, hindi po yun na gagawin ng DepEd Central Office na kung may mangyaring adverse event. Hindi eh. Dapat yung local health system po yung mag-alaga. Over to you, ma'am.
Yes, thank you. Wala na akong sasabihin. Thank you for clarifying, Doc. Anyway, siguro last na lang. So, ma'am, ang registration na ano talaga, na kailangan ay sa kung saan ka nakatira. Hindi po pwede na doon kung saan ka nag-work. Ganun po ba yun?
So, ma'am, ngayon po, no, by default, kung saan ka nakatira, di ba, for LGUs. Doon sa mga private companies, sa kanila, syempre, kung saan sila nag-work, di ba? So, employees sa taga Makati, they work in this big firm, edi dun sila, no? So, pero by default ngayon, it's really where you are a resident. But then the different LGUs have also loosened their criteria, di ba? Basta nagpa-register ka sa kanila, no? So, okay sila. I think yung sa side natin, sa national, basta hindi lang sila nag-uulit, di ba? Basta nade-duplicate lang natin yung system, okay na sa atin, regardless saan gusto magpa-sign up ng mga tao.
Ayun, so klaro po ha, yung instructions din. So I think Doc Beverly, wala na po rin tanong, wala na rin Bonnie sa audience natin. So okay na po. So siguro Doc, wala na si Dr. Gloriani, ano? Si Doc Beverly na lang. Doc Beverly, siguro last nyo sa ating mga tagapakinig dito sa ating sa programa po ng gobyerno on vaccination.
So, everyone, maging excited tayo, no? Kasi this is added protection for all of us. Hindi natin sinasabi na, savior natin yung bakuna. Pero it's really just an added protection for all of us. Lalo na sa mga nakakatanda, no? At kahit tayo, kung hindi tayo nakakatanda, it's the people that we interact with. It's our way also of making sure that they're protected. That said, we understand that many are still maybe skeptical about this. And we hope that you also provide adequate feedback to us or to Ma'am Ranielda, who will feedback to us na lang how we can do our jobs better to inform you better, di ba? As promised po kanina, we will turn over the tools that we have. Then that can be cascaded din po sa inyo, but also really looking for partners who will help organize these town halls for us so that you can ask your questions. My last appeal though for everyone is to please recognize that you are considered authorities in wherever you are, in your family, in your community, in your workplaces. And if you cannot be 150% sure that what you're saying is vetted information or is verified or is consistent with DOH advice or CDC advice, I suggest po if you can keep it to yourself first and find a way to verify it. Kasi yung problema po natin yan, hindi walang nagsasalita. Sobrang daming nagsasalita, sobrang daming opinion. Let us contribute by minimizing the noise of incorrect, inaccurate news and really just recognize na kapag isa po sa atin dito sa call, nagsabi na, o nga, hindi ko nga yan sigurado baka ganyan yan. A lot of people may base their decision on that sinabi natin, di ba? And that could be destructive. In the same way as if isa po sa atin dito, very confident na sinabi na nakapagbasa ko ng tamang informasyon, etc. Guys, let's go for it. That vote of confidence can also go a long way. No? So we are looking to you, our colleagues in DepEd, teachers specifically, you know you are the influencers in your region. Hindi na natin kailangan mag-social media influencers. Kayo talaga yon. Pero request lang po namin na sana magamit natin yung voice natin in the most responsible manner. And rest assured that the materials you will need for that, we will turn over to Ma'am. And siya na po bahala mag-share sa inyo. So maraming salamat po, DepEd family.
Thank you so much, Doc Beverly.
Ayan, marami pong salamat sa ating huling speaker, si Doc and Director Beverly Ho. And we will now present our Certificate of Recognition. From the Department of Education po, we would like to award the Certificate of Recognition to you, Doc Beverly Lorraine Ho, for being our resource person for today. At sa ating pong audience, mula sa Zoom, even mula sa Facebook Live, I'm sure marami po tayong natutunan today. Palakpakan naman po natin ang ating mga speakers, si Doc Alethea, Doc Nina, and si Director Bev. Palakpakan po natin sila, bigyan natin sila ng virtual clap. dahil marami po tayong natutunan from them today. Ayan. So, mukhang patapos na po tayo sa ating programa for today. For our closing message, let us welcome Director Lope B. Santos III from the Bureau of Learner Support Services.
Thank you very much, Leandra. Congratulations, Director Ronnie. Marami tayong audience sa FB Live at tuloy-tuloy sila nakikinig ngayon. No? Pati yung sa mga participants po natin na nag-stay, maraming salamat. Dr. Beverly Ho, napaka-klaro ng iyong paliwanag at nagabayan mo yung aming mga personnel dito sa DepEd at dun sa ating mga division levels. No? So, nagpapasalamat po kami sa mga nauna nating resource speaker, kila Dr. Gloriani, Dr. Di Guzman, at syempre po sa ating dalawang undersecretary na nagbigay din ng message kanina, Undersecretary Yusek Alain Pascua at Undersecretary Jesus Mateo. Yung aming bureau, yung Bureau of Learner Support Services, ay yung School Health Division po ay nag-a-act din as secretariat dun sa ginawa ng DepEd na DepEd Task Force on COVID-19 at lagi pong may partnership tayo, Dr. Beverly, with regards to several health programs, no? At nais kong samantalahin yung pagkakataon nito na magpasalamat sa tuloy-tuloy ninyong suporta sa mga programa ng DepEd, particularly dun sa health. At syempre itong concern ng COVID-19, while it is also a public health emergency, it is also disaster response. Kaya nagtutulungan po ang Bureau of Learner Support Services at ang Disaster Risk Reduction Management Office ng services ng DepEd para po dito. At napakaganda nung ating discussion ngayon. Marami pong naliwanagan, pati kami dito sa Central Office ay nabigyan ninyo ng tamang gabay para yung susunod naming aksyon will be guided by your information. And I'm sure ang aming Secretary Leonor Magtolis sa Briones at ang Secretary Duque ay madalas ding nag-uusap tungkol dito sa koordinasyon sa immunization program. Maraming salamat po. Again, congratulations, Director Ronnie at sa DRRMS staff. Maraming salamat, Dr. Beverly Ho. Thank you very much.
Thank you, Director Lope. And now for our final remarks, I would like to welcome Director Ronilda Co from the Disaster Risk Reduction and Management Service.
Thank you, Lily, Leandra. Wala na po akong masyadong sasabihin, kundi magpasalamat lang sa inyong lahat sa araw na ito, sa pagdalo dito. Ito po ay hatid ng DepEd Task Force COVID-19. Kasama po dito ang DRRMS, of course, ang School Health Division natin, ang DLSS, pinangungunahan ni Director Lope. No? At kasama rin po natin dito ang BHROD. So, iba't iba po kaming opisina na nagtrabaho nito para ihatid sa inyo ang tamang impormasyon, kaalaman, para po maliwanagan tayong lahat. So, kami pong tatlo na opisina rin ay meron pa pong mga susunod. No? Naglalatag po kami talaga ng isang buong programa para po meron talaga tayong hindi lang yung kung ano-anong webinar, pero may connect talaga siya para po masundan natin, no? Ang kwento, ang programa at ang hinihinging contribution din sa ating lahat. So sa loob po ng DepEd ay pinag-uusapan natin sa kasalukuyan ano naman ang magiging bahagi natin dito sa programang ito ng government. Pero sa kasalukuyan bilang ang unang-una nating ginawa muna ay mag-leveled off tayo. No, tayong lahat sa kaalaman. Kasama na po kami doon, no? Sa ating mga kumbaga parang beneficiaries din, no? Ng information, ng right information. So thank you everyone. So we hope that meron pong mga naliwanagan, may mga agam-agam na naging na naging payapa. At kung may mga tanong pa, sabi nga ni Dr. Beverly, tignan natin paano po yung mga iba pang tanong na pwede natin mabigyan pa ng mga tamang kasagutan mula po doon sa mga involved talaga, mga experts natin sa gobyerno para po dito sa programa ng vaccination. So, happy lunch po at magandang tanghali po sa inyong lahat. Thank you.
Thank you, Director Ronnie. And that concludes our webinar for today sa ating mga tagapanood dito sa Zoom at sa Facebook Live. Don't forget that for you to access your certificate of participation, sagutan po namang ang ating evaluation form. This is sent to your registered email. Ito po, nandito po ang link sa ating screen. Once again, for you to access your certificate of participation, please answer the evaluation form presented on this screen. Marami pong salamat sa lahat at happy lunch!